Good morning, everyone. Happy Monday to all. My name is Councillor Chris Moyes, and I am the chair of the Board of Health. In the room, we have Director Zhao, Director Chandra Balan, Director Ozode, Councillor Perks, and Director Roy. And online, we have Councillor Thompson. And Director Singh is there. I just saw that now. Welcome, Director Singh. Wonderful. So the board secretary has confirmed that we have quorum, so I'll call meeting number 4 of the Board of Health to order. And again, welcome to everyone. Today's meeting is being held with board members and city staff participating both by video conference and in person at City Hall in Committee Room 2. Normally we're in Committee Room 1, but this one's a little bit cozier and smaller, which is fine. City Hall is open to the public, and anyone is welcome to attend the meeting at City Hall today. The public may continue to participate electronically by video conference. This meeting is also being live streamed online at youtube.com/Toronto City Council Live. I ask everyone for their patience with any delays and technical issues. The clerk staff will connect all remote registered public speakers to the meeting by audio. The list of speakers can be viewed online by visiting the Board of Health page at toronto.ca/council and clicking the speakers box for today's meeting. The board secretary has also emailed the speakers list to all directors. Directors, this is a paperless meeting. The board secretary has provided all agenda materials on toronto.ca/council and via CMP, the clerk's meeting portal. Directors, please keep your mic muted unless you wish to question staff or speak to an item, and ensure that your video is turned on. As part of each agenda item, I will ask directors to raise their hand or unmute their mic if they wish to question staff or speak. I will then create a speakers list and will call on directors when it is their turn to speak. When voting on an item or a motion, I ask that directors ensure that they turn on their video and to raise their hand to indicate their vote. Directors, I want to remind you that you must submit and approve your motion by email. Staff are available at boh@toronto.ca to help with motions. Before we proceed, I'd like to start with the land acknowledgement. The Board of Health acknowledges the land we are meeting on is the traditional territories of many nations, including Mississaugas of the Credit, Anishinaabeg, Chippewa, Haudenosaunee, and Wendat people, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous peoples from across Turtle Island, and we are grateful to have the opportunity to work and live on this land. As public health professionals and members of the Board of Health, we recognize the historical and present-day traumas inflicted upon Indigenous peoples. We stand with communities and families as they mourn the loss of loved ones who were sent to residential schools and never returned. We also acknowledge our complicity in ongoing colonial violence. We commit to supporting the efforts of Indigenous groups towards reconciliation and action-oriented practices, including the equitable use of resources. We strive to learn Indigenous histories and collaborate with communities and families so we can create safe spaces that honor Indigenous cultures and ensure that Indigenous perspectives are present in our work and practices. As a Caribbean Canadian, I am committed to continually acting in solidarity with our African, Caribbean, and Black communities seeking freedom and reparative justice in light of the history and ongoing legacy of slavery that continues to impact our communities across Canada. As part of this commitment, I would also like to acknowledge that not all people came to these lands as migrants and settlers. Specifically, I wish to acknowledge those of us who came here involuntarily, particularly those brought to these lands as a result of the transatlantic slave trade and slavery. In support of the City of Toronto's ongoing efforts to confront anti-Black racism, I pay tribute to these ancestors of African, Caribbean, and Black origin and descent. Are there any declarations of interest under the Municipal Conflict of Interest Act? If you have an interest, please raise your hand or unmute your mic and indicate the item number and the nature of the interest. Are there any? Okay. Next, we need a motion to confirm the minutes. Councilor Malik. All those in favor? All those opposed? That's carried. We'll now move to the chair's remarks. Again, good morning, and Councilor Malik is with us, and Councilor Bravo is also here. And welcome to our fourth Board of Health meeting of this council term. During this meeting, we will have the opportunity to review Toronto Public Health's work on two major items: student nutrition and access to dental and oral health services. As we know, Toronto Public Health has been the primary dental care provider for the city's low-income population for decades. These services have helped Torontonians without private insurance and who cannot afford clinic care. Dental and oral health affects the whole body, not just the mouth. There is a strong correlation between periodontal disease, those of the mouth, and systemic diseases such as lung infections. Poor oral health can also greatly affect the mental health and well-being of patients. Dental and oral health care is health care. It is in the public interest to ensure that we have a healthy society, and that includes the health of our mouths. Our motion today will authorize the Medical Office of Health to ensure into agreements with community health centers, Aboriginal health access centers, hospitals, academic institutions, and other healthcare agencies to expand critical dental services across the City of Toronto to communities and populations that require them. There are a number of topics coming to the Board of Health that are close to my heart and my experiences. As a former Toronto District School Board trustee, I know the importance of student nutrition and how it affects their day-to-day learning and quality of life. Student nutrition programs help to ensure that children and youth at risk of poor nutritional intake have access to safe, adequate, and culturally appropriate nutritious food. When students are provided healthy meals at school, they are better able to focus on their education. They score higher marks on reading, math, and science, and are more likely to graduate high school. These programs are critical for our kids and our city. Student nutrition programs operate in 619 schools, communities across Toronto, most of them located in public schools. These programs provide healthy meals and snacks options to over 227,000 students every school day. These investments from the city are important for the continuation of this program, and I'm looking forward to hearing what staff presents to us today. So thank you again for your time and dedication. I'll turn it over to Dr. Davila for her opening remarks.
Thank you, Mr. Chair, and good morning, everybody. Today, as you've just heard, the Board of Health is considering two items which have a long history at Toronto Public Health and indeed throughout the City of Toronto: the Student Nutrition Program and Dental and Oral Health Services. These items may seem, on the surface, to be about program expansion and legal agreements, or they may seem to be about program delivery and funding details. But no matter which way you look at it, Toronto's Student Nutrition Program and the Toronto Public Health Dental and Oral Health Services, these programs contribute to a vibrant city and a brighter future for Toronto's children and youth. Public health dental services play a crucial role in promoting oral health and preventing dental diseases. By providing accessible and affordable dental care to the community, these services help improve overall health and well-being. Student nutrition programs ensure that children have access to nutritious meals during school hours, and we know that proper nutrition is essential for children's growth, for their development, and for their cognitive function. By addressing food insecurity and providing balanced meals, these programs support children's learning and educational outcomes. Well-nourished students are more likely to perform better academically. leading to a stronger educational foundation for the future workforce and for our future community leaders. Both of the programs under discussion today aim to reduce health inequalities by addressing disparities in access to health care and to healthy food, and prioritizing at-risk populations, including low-income individuals, children from equity-deserving groups, and communities with limited resources. By providing equitable access to dental care and nutritious meals, they help level the playing field and contribute to creating a more inclusive and fair society. Public health dental services and student nutrition programs create opportunities for community engagement and for social cohesion. By fostering collaboration and involvement, they strengthen community bonds and promote a sense of belonging. This collective effort contributes to building resilient and connected communities, both of which are foundational to health. In this way, public health dental services and student nutrition programs contribute to city building by promoting health, education, social equity, community engagement, and economic well-being. By addressing the needs of vulnerable populations and investing in the health and well-being of citizens, cities can create a strong foundation for sustainable growth and development. Together, I ask that we continue to prioritize the health and well-being of our citizens, young and old alike. Through our concerted efforts, we can create a stronger, healthier, and more prosperous future for all residents of Toronto. With that, Mr. Chair, I'll now hand it back over to you.
Thank you, Dr. Davila. So we have 3 items on the agenda today, all very important, of course. HL 4.1, 4.2, and 4.3. Item HL 4.1, expanding access to dental and oral health services for Torontonians. There's a staff presentation, so this will be held down. Item HL 4.2, 2023 Student Nutrition Program Services Subsidies. There's also a staff presentation on this item, and there's also 2 speakers as well for this item, so it will be held down. And the last item is HL 4.3, making electronic participation for the Board of Health permanent, and update on review of the Boards of Health procedure bylaws. And there's also 1 registered speaker in this item as well. So in that case, I guess we'll head back up to item 4.1. And so there's a presentation, and as I mentioned, and I will ask Dr. Davila to introduce the presenters. Go ahead.
Thank you, Mr. Chair. Yes, we do have a presentation and we have some presenters, so perhaps I'll make some introductory remarks while our presenter and guests make their way to the presenters table. We are bringing forward, as you've heard, a presentation and report for your consideration entitled Expanding Access to Dental and Oral Health Services for Torontonians. This report provides an overview of the Toronto Public Health Dental and Oral Health Services program, which has been serving the residents of Toronto for over 100 years. Upala Chandrasekhara, the director responsible for the Dental and Oral Health Services program at Toronto Public Health, will be walking you through a presentation. Also in the audience today, I am pleased to welcome Dr. Manisha Mehta, who is a dentist and a member of our dental management team. I don't have a good view of her from where I'm sitting, I believe. Oh, there she is, over there to, I thought you were over there at the back. Welcome, Dr. Mehta. She is the manager responsible for our dental clinic located at the Scarborough Civic Center, and she is also responsible for our school oral health screening program. Before the presentation from Upala, we have a guest presentation from Mr. Liben Gebra-Mikael, the Executive Director, welcome, of Taibu Community Health Center, which is located in the Malvern community in Scarborough and supports African, Caribbean, and Black community members in the Greater Toronto area. Also joining us today, very special guest, Mr. Mohammed Masoudi. Mr. Masoudi is a resident of the Malvern community, a client at Taibu Community Health Center, and also a client who has received dental and oral health services from Toronto Public Health. Toronto Public Health and Taibu Community Health Centre have a long-standing partnership, which we're very pleased with, and so happy to have our guest here today. And one of our dental clinics is actually located in the Taibu Community Health Centre itself. The reason we invited our special guests to join us today is so that they can share with us the importance of the partnership that we have and the value that we together bring to the community by working side by side. Mr. Masudi, Mr. Geber-Michael, we are very, very grateful at Toronto Public Health to be working so closely with you, our community partners, and I thank you once again for joining us today. So I'll hand it over to you at the presenters table.
Okay, good morning. It's a great pleasure to be here representing Taibu Community Health Center. It is not my first time being here, so I'm still nervous, but it's a great honor to come here and share some of the experiences that we have and the importance of a partnership with public health, Toronto Public Health, and other organizations as well. I just want to go through very quickly around Taibu for those who don't know about the organization and the services that we provide. So if we can advance the slide, please. Next slide. Next, please. So our mission, Taibu is 15 years old this year, and we've been established in 2008. And we had the privilege of working with Toronto Public Health from the very beginning through the leadership of Dr. Hazel Stewart, who really made sure I'm very, very honored to have worked with her, to have dental services be part of community health centers. I think that's very important. Next slide. So our mission, as was described briefly earlier on, is to serve the Black population across the Greater Toronto Area as our priority population, but we also serve all the residents of the Malvern neighborhood, irrespective of their background. And we also have, over the years, established a particular focus on Francophone population in Scarborough, knowing the Francophone population, our newcomer population, and also exhibit a lot of health problems. Next slide. And the values, it's okay if we can go to the next slide. These are values that are very important for us in terms of community-driven, building Afrocentric values and principles into the work that we do, quality and equity being the important components of our services. Next slide. We've done quite a lot of work over the past 15 years, and we've been recognized, for example, the inaugural Scarborough Hero Awards for the work that we've done during COVID pandemic responses. The JCA and the Black Health Alliance have also recognized our leadership around community engagement and partnership. Next slide. The underlying reason or mandate why a Taibu had to exist, the organization was led by the Black Health Alliance into its establishment. And we know that there are various health outcomes that disproportionately impact Black communities, whether it's mental health, physical health, chronic disease, and all the other social determinants of health, oral health being also part of the disparities that we face. Next slide. A very good example is also how COVID has impacted the Black communities. We know at the beginning of the pandemic, the disproportionate rate of incidence of COVID-19 was significantly higher. It was about 24% when COVID hit in 2020. Through the work that we were able to do in partnership with public health, whether it is the collection of race-based data, but also the location of different services and engagement with communities. Over a year period, we were able to reduce the impact of COVID from 24 to 14%, as you can see from this. The next slide. The other thing that we are also conscious about, this is also from the City of Toronto and the map of the incidence of COVID-19. And if you can advance it once more, you would see the two areas where COVID hit disproportionately. I've just put here one map because we don't have too much time, but if you were to overlay different maps of inequities, whether it's diabetes, mental health, poverty, they would fit nicely into these two areas. And so for us, a partnership with the city and public health in Scarborough is very important. Next slide. As an organization, we also wanted to ensure that when communities are accessing our services, they can connect, not just because it is a service that is available for them, but it's also a connection to who they are as a community and as a population. And so we have embedded Kwanzaa principles and values into the program that we do, and through that we have developed a model of Black health and well-being. If you can advance the next slide. You will see that we have developed a way of engaging our communities through three pillars, the goals, the principles, and our practice. So our goals are predominantly, the three main goals that we have is prevention, restoration, and advancement. And if you can, the next slide. I usually use this analogy that I learned from a great epidemiologist in the United States, Dr. Kamara Jones. And if you see here, if you look at any equity issues in health, you would see that there are people who are falling down the cliff. And when it comes to equity deserving groups, you will see more racialized people falling down the cliff. And next slide. And you will see most of the time attention is given at the bottom of the cliff after people have fallen down. So if we have huge increase in emergency department visits, then we will say, oh, we need more hospitals, we need more staff, we need more ambulances. If we have a community safety issue, we would say, oh, we need more police because we're seeing this. But the services that we are thinking about is at the bottom of the cliff and it's too late. If we're lucky sometimes, next slide, we put some safety net to say, okay, maybe we should catch people while they're falling, and maybe we will catch them and maybe we will miss them. But I think from a Taibu perspective and many community health centers, next slide, is how do we stop people from falling down the cliff in the first place? And can we put a fence or a wall? And that's what upstream work that we do, and community health centers are known to be doing that. But we also go one step further. So next slide is, actually we should do a lot of health promotion program to move people away from the cliff in the first place and keep them healthy. And I think, you know, that this model that we are thinking and using helps us to engage with different community partners to move people away and keep them healthy. And so how can we do that is a question that we always ask, and I think it is also something we should consider for oral health and dental health. Very briefly, next slide, some of the programs that we provide, including primary care, low back pain program, diabetes education, mental health services, seniors programming, exercise classes, perinatal and maternal health, partnership again with Toronto Public Health as well. And very recently, a partnership with the city is the Toronto Community Crisis Response Team. Again, we are saying that if we have to respond to community crisis, we're already late. So how can we bring, the services to communities and start engaging them to be able to identify issues before a crisis happens? Other initiatives that we have, as I said, next slide, is the Francophone services. We have a specialized primary care services for Francophone and other health promotion program and services. Next slide, we do a lot of work around mental health. We have identified this as one big issue in our communities, particularly after the George Floyd incident and also the pandemic. And so, we partnered with the city again to establish the Black Mental Health Week that happens during the first week of March. Next slide, we have been very active around COVID-19 responses, and we were one of the identified COVID-19 vaccine space during the pandemic. We've vaccinated over 45,000 community members. We've also, next slide, we've also used data collection, race-based data collection to help us with the planning and also implementation of the vaccine clinic. We have a report that we published in September. Next slide, please. Again, next slide, sorry. Just very briefly, the other component, next slide. The other component that we're also working at, besides the Afrocentric values, is to start thinking about systems change. The issues that we try to address around Black, Francophone, racialized health issues are systemic in nature. And so if we just do programs and nothing else changes, we will be looking for money to do programs, and that's all we've been doing. So we have developed a systems change approach to the work that we do, whether it's around youth, whether it's around Black health or education and employment, and also delivering board and governance training and leadership through a funding that was provided by the city. And actually the Black governance and leadership first engagement session was with the Board of Health. I can't remember how many years ago, but just before the pandemic, I think 2019 December. And we'll be very happy to come back again and do a session here. But system thinking is very important. And the last piece I will mention is, well, two last pieces, next slide, is we strongly believe around community engagement. And we have engaged a very active a seniors group under the Ubuntu Village Project, so that the seniors themselves are the ones who are deciding what kind of programs and services are implemented in Scarborough, and we're moving it to the West End. And then research and capacity building is also something that we are doing. For example, the next slide, we've done a research around food security issues and the impact of the pandemic. Next slide, we have developed a tool guide to establish or to implement Black health and Afrocentric healing circles. And next slides, we have developed a documentary that talks about anti-Black racism in the workplace. It's called the Working While Black documentary, that we are taking to different spaces, including corporations, organizations, City of Toronto spaces. And then lastly, very recently, we've started another significant project, next slide, around HIV/AIDS, HIV treatment. This is based from the evidence that shows that, particularly with Black communities, there is a huge gap between diagnosis of HIV and access to appropriate care and services. Through the leadership of the Black Health Equity Lab at UTSC, led by Dr. Notisha Masakwai, we have this partnership program where Taibu is going to have a clinic that is going to provide a culturally affirming services for people who are impacted with HIV. I will stop there, and if there are any questions, or maybe Mr. Masudi. Okay, Mr. Masudi can go. Thank you.
Thank you for all of you, so that I'll be here, one of the patient and Taibu community. And from the beginning of the starting of this Taibu community, I was there, one of the residents in that area. So I'm one of the patient involving there with several activities also that they have provided for us as this community. And it was really very helpful community for us, because it is everything under one roof, especially our family doctors and also cardio practitioners. And moreover, there are nutritional aspects are also there. But the only thing what is happening is here the daily exercise programs. Although they have got some exercise program, but we don't have a gym to be there. So that's also very important aspect of that to be mentioned. And that also, I hope that Taibu community will be providing that for our community, and especially for our seniors. As in the senior programs are also there in the Taibu community, and these dental programs are one of the important aspect of that. And I am receiving a dental program in that community, and I'm very satisfied with the service they provided for me, and they have made, I made a denture there also, and also they have made some filling up of my tooth, and some extractions has been done and that community. So our dental program is very good, and they are proceeding it very well. But the only thing is this, that it has to be improved a lot, because there are lack of appointment, because it will take a long time for our seniors to get appointment, because there is less doctors there, so they have to improve of that area, because there are so many of our seniors and all, they have got problems with their dentures and also with their tooth. By the time their appointments are approaching, they have developed several complications in their mouth. So that is happening for some of the seniors. I hope that this area should be covered promptly. Although there are some new areas they have covered, some new facilities are coming there. Lastly, when I went there about a week ago, they were taking care of my tooth, and I saw the new chairs are there, but still that old gadget of taking x-ray of our tooth, so that is still there. But I hope that the new gadget that they are implemented there, that should be provided for them, so that our x-ray should be a very prompt, and that should be a very good aspect of that I saw there. So I hope that should be improved. So I'm very satisfied with all the services which they are providing for us, especially for Taibu community. It is amazing. It is amazing in all aspects of that. So it is a thrilling area when you go there and you see the doctors, and you see the approach, what the doctors are approaching, and the pharmacy and everything, which is all under the roof. It is really very, very convenient for all the seniors and also the families. And also the nutrition aspect of that is going very well. So because for the diabetes, usually they are calling us for the nutrition aspect of that. How do we have to manage our diabetes? That is also a good program. They've got all the good programs there, and I hope that should be continue forever, and that service should be provided for all of us. Thank you very much for having me that here, so that I have to express myself. What I've seen, that was the truth. Bye now.
Thank you, Mr. Mazzotti. Forever is a long time, but I hope it's forever too. And also thank you to the Executive Director of Taibu for his presentation.
Mr. Chair, I think we have a couple of options, just for their time. If there are questions specific to them, then they can go. There is still a staff component of this.
Yeah, okay. So we'll break it up in two parts. We'll have any questions for the Taibu folks, and then we'll have public health staff do the presentation afterwards. Any questions for Mr. Masudi? Or Mr. Gabra Mikhail. Yes, give me a second. Pardon? Trustee, I know. Trustee Srishkandaraja. I'm thinking it's not director, it's not counselor. It's Monday, yes. Trustee Srishkandaraja.
Councillor Moyes, did you forget me already?
Never.
Thank you. Through the chair, thank you for your presentation. I just wanted, I think, maybe have two questions. So at the TDSB, we often break down the category of Black, which is obviously very complicated in our city. So I wanted to know if you could discuss more how and if there's a difference between African populations and Caribbean populations, because I think oftentimes they obviously get lumped together but can have diverging experiences.
Definitely, I think it's a very good question. I think there is benefit of, putting everybody together and under the category of Black from a systemic perspective. But it's more important to also note the diversity within the Black communities and the intersectionalities for various reasons. And one of the reasons is experiences or presentation of different challenges. With the Caribbean population, we have people who have been here for a long time, and so they have their particular need. With the African contingency, we have more newer comer population, and so we also identify various health concerns and other social concerns as well. So I think it's very important to do that, and within that also to then look at what are the other diversities that exist within the African continent. If you are Francophone speaking, you have additional barriers. If you are from, the Muslim community, you have additional barriers. If you are from the LGBTQ2S+ community, then you have, right? So I think, when we do our work, as much as possible, we try to, we say we serve the Black communities, but we're looking at different intersectionalities and diversities within Black communities. Something that is also, that we are observing, and it happens a lot, is the African contingency communities are less engaged with systems than Caribbean communities. If you go to meetings, if you go to engaged communities, you would find more the Caribbean population than you see the African population. So it's good to find and say, who are we not seeing at the table, who's not accessing services, and then try to engage with existing groups or try to develop relationship with communities and doing that. And we see that in schools as well, definitely. I mean, we do a lot of work in schools as well around suspension and expulsion. And that's also what we're seeing is the diversity of communities and how they are accessing services, but how they are also impacted by systems. So it's a very good question.
Thank you for that. Yeah, I think that's a important conversation we keep at the forefront, and I know you do that in your work. I'm very aware. I serve Malvern, so Taibu is very, very close to home. And so I think that conversation often gets missed perhaps when, beyond our communities on the two different needs and those internal relationships, right, and how difficult that often can get. And I see that when we lump South Asian all together, and we have so many differences within that category and working together and what that could mean. So I appreciate that. And the last question I wanted to know, if you could speak a little bit more to Plug. I know that's in your presentation, and I know you mentioned you do more work with school boards. So I think that would be beneficial for everyone, and particularly me.
Thank you very much for that opportunity. So the Plug project is a project that was designed to address the disproportional impact of suspension and expulsion in schools. The name Plug is connecting the youth to the different services that they need. So that's where the name comes from. It was initially funded by Legal Aid Ontario as a pilot program, and it's a partnership that's taken place at Malvern and also in Etobicoke with Rexdale Community Health Services. And the idea, the project is to go into schools, as I said earlier on, as early as possible, if it's possible, to engage with students, Black students and their parents, and try to negotiate some of the challenges that are exhibited. Because we know, the disproportionality of, TDSP Black student population being 9%, having, about 40% somewhere around there around suspension and expulsion is not because Black students are very disruptive in class. There are other underlying issues that are happening. So our project is to go into schools and work with students to try to kind of bring in these issues and knowing how to navigate the school disciplinary measures and how to avoid or mitigate some of the challenges that they may face either with administrators or teachers, right? Working with the administrators and teachers and providing either workshop or other engagement types to try to see if they can change the way that they also see certain things. Classic example would be a disciplinary behavior that is exhibited by a non-Black student, a white student, and the approach that is taken is completely different to when a Black student is exhibiting the same problem. Why is that? And having those conversations. Then there is the, if there is a disciplinary issue that is on the table, then we try to work with the school to try to see if there are alternative methods of addressing that. Not all suspensions and expulsions are appropriate, but sometimes there are also suspension and expulsions that are appropriate, and how do we mitigate that? But for those that are really not appropriate, then there is a third element of supporting Black parents and students to know their rights around the Education Act. Two, to see if they can be supported through the appeal process, and supporting them through legal advice and support. After the pilot project with Legal Aid Ontario, it is now being funded by Public Safety Canada, and about 85% on average of cases that we have dealt with, we were able to withdraw, to get the suspension on expulsion withdrawn. If we were too late to support Black parents, at least to get those records expunged, because we know also that when a record follows you, you are likely to be targeted for, this kind of thing. So about 85% of our cases, we've been able to get that withdrawn or the records expunged.
Thank you. Director Zhao, go ahead.
Thank you, Dr. Gabrielle McKell, for the informative presentation, and it's great to hear about the services that you provide. So I just have a question. For patients to access your services, do they have to be rostered to your clinic, or can anyone, regardless of catchment area, access the services that your CHC provides?
Yeah, so we have a roster or a registration of clients. And so for people who identify as Black, irrespective of where they are in the GTA, can access the services. The other criteria is you have to be a resident of the Malvern neighborhood. So if you are there, you can also register and access services. And if you're Francophone in Scarborough, then you can also access the services.
Do you ever find that's restrictive for patients, or do you find that you're still getting a lot of patients and having wait times?
We have wait times. Wait times because we are receiving new clients, at one time. So it's taking a time to kind of get them through the system. It's not restrictive at all. Capacity is our issue, not so much the access.
Great, thank you.
Go ahead, Director Ozodi.
Thank you so much for the presentation, and I've actually been a client of Taibo in the past, so I definitely understand the services I provide. You'd mentioned in your presentation that the Francophone Black community in Scarborough, they face more health challenges. Am I correct? And I know that the Francophone Black community has been increasing in the city, not just in Scarborough, but in Etobicoke North, which I live. Is there any particular reason why this is? Is it tied to, language barriers, or are there other things operating in the background?
Yeah. So one, the language barrier has a significant impact in how people are receiving information and accessing information in their own language. That's number one. Many of the newcomer Black Francophone communities are also coming in with some challenges already because of pre-migration issues that they have gone through. We are also observing in our client population that we have a younger Francophone population compared to our Anglophone population, but we also are seeing a significant, a higher incidence of chronic disease, including diabetes and hypertension, with the lower age population. That's really, really significant for us. When we found out, we were like, how come this is happening? So those are the challenges. And so if they're not accessing services, newcomers with language barriers, accessing services that is culturally appropriate for them creates a challenge. And then mental health is the significant challenge as well. And so with primary care, the challenges may not be, they are significant, but when they go to specialist services and now the language barrier is a problem, receiving services diagnosis or other kind of services becomes problematic. So our primary care nurse practitioner, for example, has to broker all this kind of specialist service referrals to make sure information given to the specialist is the right information, and then the information given by the specialist to the clients is also accurate, because they come and they say, oh, you know, I've been told this, which may not be the whole story. So those kind of challenges are huge, and understanding the culture of many African people from African continent is also something very important.
Thank you for that. And when I had access to Taibo's services, that was during COVID, you know, the mental health program. And were there any lessons from, you know, from the lockdowns that are still being implemented now? The one that comes to mind is like virtual health, you know, telemedicine, even phone calls that could help in the delivery of the services, or even just to help cut down some of the wait times for folks who can come in person.
Yeah, I think one of the benefits of COVID was the expansion of virtual care. Sometimes forced the virtual care for clients who were not always comfortable in accessing virtual care because there was no other options. At least from community centers, CHCs, we were never closed, we were open, although we restricted access both from public health perspective. And so that is still ongoing. We're still continuing to provide virtual care. For some reason though, what we are seeing at least at Taibo is people want to come and see their doctor. I think it's beneficial for people who have transportation challenges and stuff like that to come. As we know, Scarborough is a challenging place to navigate with public transportation. But many clients want to come and have that face-to-face. I think, I don't know, it's also because there is a relationship built with the providers, whether it's the doctors or the dietitian or the social workers. It's more than a clinic, it's more a community space. So people like to come to Taibo for appointments.
All right, thank you. Councilor Thompson has a question. Go ahead, Councilor Thompson.
Thank you very much, Mr. Chair, and good morning to everyone. Through you to Lieben. Lieben, thank you for your excellent presentation. Of course, your always excellent and amazing work that you do with Taibo and all the people there. Just a couple questions for you. The first one, the Canada National Dental Benefit. Does Taibo participate, or is there a formulation or a way that Taibo can participate without perhaps other agencies' involvement? Is there a direct relationship between the program that you offer and the federal government's program?
No, as far as I know, there's no connection. And I think the federal program, if I'm not mistaken, is directed to families and individuals. I think our role will be to highlight this and provide information and education for families to take benefit of this opportunity that is provided by the federal government.
Yeah, and the reason why I ask you because how centrally located you are in the program that you know, the service that you provide to the community. I'm just wondering whether or not there could not be a better established relationship with respect to the feds and Taibo. This is a curiosity on my point, so when I've heard your response. I don't know if you wanted to add anything to that. I do have another question for you.
Yeah, no, I think that's, yeah. But I think we will do the engagement and
Right.
the promotion and the education, because many of our communities, as you well know, Councillor Thompson, even though the information is available, they need to be assisted with accessing that information, understanding, and also taking participation in that. So that would be our role. Thank you.
Sure. And can you tell me, with respect to the number of young people, youth, that you are helping your clinic help with respect to dental care and so on, what is that population number?
So that probably would be with public health. I think the clinic collects the information.
Okay,
Taibu-
and maybe they can provide that answer
Yeah.
later. And so my final question to you, given the culturally important and significant role that Taibu plays, and you have obviously presented that through your presentation this morning, but of course we know of your history and the work that's done. I'm wondering about collaboration between the SHN and the service that they provide. I often get from my constituents that they are very concerned with respect to what is the lack of culturally specific services that are being offered. Given the role that you and Taibu play in the community, I'm wondering if there is perhaps a teachable moment, an opportunity to collaborate, and if you have expanded or looked at that opportunity, because I think it would be really beneficial in helping the SHN as an organization.
Thank you for that question. Yes, I think we are doing some work with the Scarborough Health Network. We have been doing a lot of work prior to that. One example is the pilot project we had around sickle cell disease, and so we worked very closely at the time with the Scarborough Hospital. That was before the merger, and then COVID came, and so we're still now going back to having those conversations and making sure that a partnership service can be collaborated with the hospital to provide those services. We also do, when the opportunity exists, to do in-service for their staff and leadership. Very recently, we had a session with their staff around anti-Black racism in the workplace, using our documentary, The Working While Black. During COVID, we made sure, for example, that our partnership really made sense for our communities, and so we had to negotiate several different ways of doing the clinic at Taibu that was not done in other places because of the client population that we serve. For example, when the vaccine rollout was put out, there was a request from the hospital to say we need to start looking at postal codes, because people outside of Scarborough, there was all this turf around vaccination and just because the number of vaccines had to be accounted for. But for us, that was a problem. So we said, postal code is not going to work for Taibu, because we have our communities that are coming outside of the Scarborough region, whether it's in Durham, whether it's in the west or downtown Toronto. We have clients that come and access primary care, and that would exclude our communities as per our mandate. So when we have those opportunities to negotiate and bring about equity issues, we do that. Is there more work to be done? Definitely. And maybe with your support and collaboration, Councillor Thompson, we would be happy to do that on an ongoing basis.
Thank you very much. Those are my questions, Mr. Chair.
Thank you, Councillor Thompson, and thank you to Taibu for your presentation and taking the time to answer our questions. I'm now going to turn it over to Appala Chandrasekera, Director of Toronto Public Health, for her presentation. Thank you so much.
Thank you so much, Chair. I also want to thank Mr. Gabber-McCall and Mr. Masudi for being here with us today and for sharing their valuable experiences. In today's presentation, expanding dental access to dental and oral health services for Torontonians, I will provide an overview of the history of our program and all of the work that's currently underway in support of the residents of our city. As Dr. Davila mentioned, the Toronto Public Health Dental and Oral Health Services Program has a history spanning over 100 years. Throughout the presentation, you will see several historical photographs. These photos were generously provided to us by the Toronto Archives, who have been documenting the incredible history of Toronto Public Health, including our Dental and Oral Health Services Program over the years. I would like to thank our colleagues at the Toronto Archives especially to Jessica Algie for their support and for these amazing pictures. Next slide, please. Oral health is multifaceted and includes the ability to speak, smile, smell, taste, touch, chew, swallow, and convey a range of emotions through facial expressions, with confidence and without pain, discomfort, and disease of the craniofacial complex, which includes the head, the face, and the oral cavity. However, the importance of dental and oral health is not just limited to the mouth. It impacts the body systemically, with many studies showing a strong correlation between periodontal disease and systemic diseases. For example, periodontal or gum disease results in the inflammation of the mouth, which can contribute to systemic inflammation, in turn contributing to cardiovascular disease. People with diabetes have an increased risk of periodontal disease, and treatment of periodontal disease has been shown to improve blood glucose levels. Periodontal disease may also have an impact on lung disease. Lung infections such as pneumonia can be caused by the aspiration of the bacteria which causes periodontal disease. Periodontal disease can also worsen chronic inflammation in lung diseases, such as chronic obstructive pulmonary disease, or COPD. Poor oral health can also affect self-confidence and social relationships, which are contributing factors to mental health and well-being. It's important to remember that oral health is part of our overall health, and dental health is mental health too. Next slide, please. Toronto Public Health has a very long history of responding to dental and oral health needs in Toronto. We became involved in school dental examinations in the early 1900s. In 1910, in a sampling of 20 schools, 97% of the students were noted to have, quote, defective teeth, with many commonly having 5 to 10 cavities each. The toothbrush drill and other methods of teaching children how to look after their own teeth were introduced as critical components of the school health service. By 1925, the rates had decreased, and 66% of students were noted to have dental defects with fewer cavities than before. Next slide, please. Over the years, our suite of services have expanded. Our downstream individual level interventions include routine dental care and clinical treatment, and we have also expanded our upstream population level interventions, such as water fluoridation and health education on proper oral care. Today, the objective of our program is to improve the well-being of Torontonians by providing high-quality, client-centered dental and oral health services. We use a minimally invasive and evidence-based approach in providing dental services to our clients. This marks a shift in practice from the traditional surgical approach, which treats only the signs of the disease, to a contemporary chronic disease management approach that treats the underlying issue. Our approach encompasses interventions such as modifying the oral bacteria, treating cavities through non-operative and preventative methods, prioritizing the repair of restorations before considering replacement, and educating clients on the disease process and identifying actions that they can take to prevent or control it. Prioritizing minimally invasive dentistry shifts dentistry away from more expensive and invasive interventions to ultimately improve oral health and overall health while also avoiding costs. We are required under the Ontario Public Health Standards to conduct oral health screening in schools to identify and prevent oral health problems in elementary school students. Where necessary, Toronto Public Health assists families in finding and navigating dental care and improving their oral health knowledge. We also provide screening and non-invasive bedside treatments to residents of city-run long-term care homes and eligible residents of nonprofit and private long-term care homes. Next slide, please. Toronto Public Health receives funding directly from both the provincial and federal governments to deliver dental and oral health services to Torontonians. This slide and the next slide provides the overview of our programs. We are very grateful to our partners at the Government of Ontario for their support through the Ontario Seniors Dental Care Program, the Healthy Smiles Ontario Program, and through Ontario Works and the Ontario Disability Support Program. Next slide, please. We're also very grateful to our partners at the Government of Canada for their support through the Non-Insured Health Benefits Program to support First Nations and Inuit communities, and the Interim Federal Health Program to support refugee populations. I also want to note, as discussed earlier, that the Government of Canada recently announced the Canada Dental Benefit. This is a nationwide program that is intended to help lower dental costs for eligible families earning less than $90,000 a year. Parents and guardians can apply if their child receiving dental care is under 12 years old and does not have access to a private dental insurance plan. Next slide, please. I'm truly proud of our team in the Dental and Oral Health Services program for all of their efforts to respond to the needs of Toronto residents over the last few years, particularly as we have also been faced with an unprecedented global pandemic. Many staff in our program were redeployed to support the COVID-19 pandemic response. They were involved with contact tracing, case management, vaccine clinics, working in jobs that were very different from dental and oral health services. And it was an all-hands-on-deck approach to the fight against COVID-19. Yet, our dental services did not stop during the pandemic. The year prior to the pandemic, when we had our full complement of staff, we served nearly 28,000 unique clients from February 2019 to February 2020. Given the importance of our dental services, especially to low-income and underserved residents, we still continue to provide a full suite of clinical services throughout the pandemic. Even without the full complement of staff, we served nearly 31,000 unique clients from March 2020 to March 2023. As noted previously, Toronto Public Health is mandated under the school health requirement of the Ontario Public Health Standards to conduct oral health screenings in schools. An oral health screening is a relatively short assessment that can indicate the need for dental care. At Toronto Public Health, registered dental hygienists conduct these screenings in schools. There are over 200,000 children enrolled in junior kindergarten to grade 8 in public schools in Toronto. The mandatory grades that need to be screened are junior kindergarten, senior kindergarten, and grade 2 in all schools, as well as grades 4 and 7 based on the overall level of dental risk for that school. At Toronto Public Health, we screen all elementary school grades because our data indicates significant urgent dental decay across many grades. The 2018-2019 school year is the last year that we were able to operate our screening program at full capacity. During that time, Toronto Public Health screened approximately 208,000 students enrolled in junior kindergarten through grade 8, identifying approximately 8,000 children with urgent dental decay, 20,000 with non-urgent decay, and 60,000 children needing preventative care. Next slide, please. Toronto Public Health directly operates 26 dental clinics across the city. Our clinics are strategically located to ensure they're accessible to clients, near communities of high demand, and easily accessible by transit. Soon we will have 2 mobile dental vans to help supplement the fixed clinics, allowing us to bring services directly to clients who may be unable to otherwise access them, such as seniors living in long-term care homes. We also operate a mobile dental bus that serves to expand our capacity at fixed clinics in areas where there is a significant demand, and to provide services at locations that are temporarily closed for repairs or upgrades. I want to make a special mention that we have a wonderful partnership with the City of Toronto Fleet Services, who provides the drivers for our dental bus. I want to thank the General Manager, David Jollymore, and the Fleet Services team. They've been wonderful support to us in our mobile dental program. Next slide, please. As a result of the high demand for dental and oral health services, and with additional financial investments from the Government of Ontario, work is currently underway to improve and expand our fixed clinics through 3 renovation and 4 new construction projects that you can see on this screen. This includes now 5 new clinics in Scarborough that are expected to open in 2023 and 2024, which will help to address the significant need for dental care in this area of Toronto. Next slide, please. We currently have made arrangements with 13 community partners and 3 local hospitals to help us expand our reach into community. We have co-located our dental and oral health services with community health centers, which enables us to tap into existing client networks, reduce barriers to access for local residents, and expand referrals to other healthcare services such as primary health care. Next slide, please. Similarly, arrangements with hospitals allows us to expand our referrals to acute care services. Toronto Public Health also supports dental and oral health services through service agreements with community partners who are able to apply their community-specific knowledge to tailor service delivery to meet the needs of their clients. Our intent is to build on the success of our collaborations with community by increasing the number and depth of our partnerships in the coming years. Here, all of the names of our current community partners are listed. And we also have a partnership with the University of Toronto Department of Dentistry as well. Next slide, please. Toronto Public Health currently has service contracts with partner agencies that support service delivery in the community for provincial programs, including the Ontario Seniors Dental Care Program and Healthy Smiles Ontario. Purchasing services from community agencies is an effective and efficient way to provide essential public health services. This approach builds on existing service infrastructure in the community, facilitates community partnerships, supports continuity of service to clients, and maximizes the service efficiencies. Under the Ministry of Health's Public Health Funding and Accountability Agreement, we may enter into contractual partnerships with organizations to provide eligible Ontario Seniors Dental Care Program clients with specialty dental services that are part of the program's service schedule, but unable through public health units. Toronto Public Health reports annually to the Board of Health and City Council on its service agreements with our partners. Currently, we must seek City Council approval on a case-by-case basis to enter into new capital funding and purchase of service agreements to flow funds from the province to service delivery partners. Given the pressing need to expand access to dental and oral health services in Toronto and the robust accountability frameworks that already exist, this report recommends that City Council grant the Medical Officer of Health authority to enter into agreements with service delivery partners for the purpose of delivering mandated services that are fully funded by the Government of Ontario. This will streamline the service expansion process and provide more timely access to dental and oral health services for eligible Torontonians. That concludes my presentation, and I want to end by taking a moment to thank all of our staff in the Dental and Oral Health Services program. Our frontline staff work hard each and every day in service to the residents of our city, caring for the most vulnerable in our community, including children and seniors. We have asked a lot from our frontline staff these past 3 years, and they have stepped forward and provided leadership in this time of uncertainty. All of our teams have worked hard to respond during the pandemic. I'm truly grateful for all their efforts, and I feel honored to work alongside these dedicated staff at Toronto Public Health each and every day. Thank you so much for listening and for this opportunity to share with you the work of our incredible dental and oral health services program.
Thank you, Director Tandra Sequeira. Much appreciated. Dr. Davila said to me that if any of the directors or members of the public is interested, Toronto Archives actually has a visual history of dental and oral. Toronto Public Health in general? Here we go. Toronto Public Health in general. If you want to go to the archives, there is, you can go there and take a look at the history of Toronto Public Health. So I'm not quite sure if they're open during open doors over the weekend, but we're open all the time. Anyways, any questions from directors to, okay, Trustee Srishkandaraja.
Thank you, Councillor Moyes. Thank you for the presentation. I just want to know if anyone can explain to me why Scarborough, with all the needs that it has, and these clinics are for those who are the least served, that can't access public clinics or private clinics. What's the rationale for this historic underserving, right? What was the decisions, how were decisions made of where these locations have historically been placed?
So the Ontario Seniors Dental Care Program was announced in 2019, and at that time, interested community agencies were able to put forward applications and proposals for where clinics can go. And so at that time, several proposals that came through Toronto Public Health were approved. And so some of the clinics that you saw on screen, they're currently being constructed now for service delivery. But we definitely have a backlog in that area. So when we think about wait times, our next available intake at the Scarborough Civic Center Clinic, for example, is summer 2024. And our next available intake in the West End, by comparison, is fall 2023. So there's great need, and we're working very hard to try to meet those needs, but just not enough services.
So if I can, Mr. Chair, just to add to that, you'll note that all the new expansion sites, as displayed by Upala on that slide, are in Scarborough, in keeping with our data. So we are very much committed towards expanding where the data suggests the need is the greatest. Hence, you're seeing the expansion work happening in Scarborough as the funding becomes available and as the programs are able to account for that.
Okay, thank you. This is incredibly emotional and frustrating. So obviously it's not personal. Staff are doing what they, are doing. I think a couple of things. I think to rely on I think we need to integrate systemically how we approach opening of new sites. So if we are depending on proposals from community organizations to be the ones that, through the chair, I couldn't hear. Oh, the question, yes, okay. So I appreciate that there's new sites coming, but to be correct, my question is one of the sites is a renovation, not an actual new site, because it's the bubble is half green and half purple.
So if I can, through you, Mr. Chair, sometimes renovations are often about expansion of service as well. So it's not necessarily just updating the equipment. When we have done renovations, we've often expanded the offertories as well. So I can't speak to the specific one without knowing the details, but please know that we are very much interested in, as funding becomes available, in expanding the services to match the need where we're seeing it. So that has been the process that has been followed by our staff as we seek to expand services as we have funding available. And I see Upala's got a comment.
That half circle one, that's at our Scarborough Civic Center location. So we have an expanded location there on the main floor. And there was also a historic dental clinic in the basement. So we're currently renovating that so that could be made available as well.
Okay. Thank you. And just my last question, I know you said the sites were, through the chair, were due to data, but this data is not new, and Scarborough has historically been underserved. So why the delay if it's data-driven?
Renovations take a very long time and construction take a very long time. And during COVID-19, all of our construction projects were delayed. So even we had Mr. Gaber-Mikel here and Taibu Community Health Center. Their clinic just finished renovating about 4 months ago, and it should have been done much earlier. And so some of those timelines are sadly out of our control, and we're in the hands of the contractors and our city partners in that process.
From the map, it doesn't seem there was delays in other parts of the city, but I will leave it at that for now. Thank you.
Thank you. Councillor Malik?
Thank you very much. Appreciate the presentation and all the work on this. I will just go back to a question that was asked earlier, and maybe if you have some more insight around it. But it is about the Canada Dental Benefit and if it does affect any of the work being done by public health.
Through the chair, thank you for the question. So the Canada Dental Benefit is that it is a benefit provided to families and individuals. The Healthy Smiles Ontario program is funding directly from the Ministry of Health in Ontario to our program. And so the difference is the Canada Dental benefit will be given to a family through the CRA, but Healthy Smiles Ontario allows us to serve children under the age of 18 in our clinics. And so another important difference between the programs is that the Canada Dental benefit's only for children 12 and under, whereas Healthy Smiles Ontario goes all the way up to 17. And so more information is slowly being available from the Government of Canada, but at this point in time, it's not directly impacting our services and our ability.
So they're kind of complementary streams that,
Yes, that's right. So a family, an eligible family and children can take their benefit to any dental provider that they wish.
thank you very much for that. This also builds on my fellow board member's question, but the report states due to provincial investments, we were able to renovate 3 and construct 4 new projects. Can you just clarify if the funding is for capital costs or operations as well?
It's for both.
It's for both, and do we have a sense of what the proportion is of the funding for capital versus operations?
We can certainly make that information available to you.
That's really good to know. And again, a question about the timeline on the projects. We don't have the timeline right now. That's important information. That would be great to follow up with.
Yes, absolutely. The new projects were, it's underway and hoping within the next year to have them available.
And can you just remind us what the income threshold is to be able to access TPH's dental program?
Absolutely. It depends on the individual. And so for children, the Healthy Smiles Ontario program, the income threshold is determined by the Government of Ontario. And so it also depends on how many children in the family. For seniors, I can give you the exact number. So to be eligible for the Ontario Seniors Dental Care Program, a senior has to be 65 years or older, a resident of Ontario, and meet the income requirements. Annual net income of $22,200 or less for a single senior, or combined annual net income of $37,100 or less for a couple. And those are set by the province of Ontario.
So will we be re-examining who can access TPH dental programs as the new funding becomes available? Is there any mechanism for that? Or I guess if it's set by the province, advocacy around that?
Thank you for the question. Yeah, the eligibility criteria is set by the province, and for every envelope of funding that we receive, they set the criteria, but also the types of services that we can provide using that funding. That's all set by the province.
There's no movement right now to kind of be pushing on that?
I think that given the Government of Canada's interest and investment in dental, I think the conversation around the need for dental care is growing. So I think there's always opportunities to have these conversations. My understanding from the Government of Ontario is that their program is not going to change. It will continue, even though these conversations are happening nationwide. No problem.
Thank you, Councilor Malik. Director Chandra Balanan, did you have a question? Oh, okay, sorry, I thought I had your hands up. Director Roy?
Thanks, Chair. With the federal tax benefit coming in, are we expecting to see impact on our program? If so, then is the funds going to be used in any other way with any other population?
Through the chair, thank you for that question. It is something that our dental management team and our staff at Public Health, we discuss a lot. We're not sure what the impact really will be. What we do know is that many vulnerable populations prefer to go to a public health dental program as opposed to a private practice. And so we can expect there will be shifts, but we can't anticipate what that will look like.
So, and Mr. Chair, if I may add to that, you ask a very good question. I can tell you that from my understanding with our provincial counterparts, they too are looking at this question around how best to offer service that makes sense given the Canada Dental benefit, and that is a question that is, one that is actively being considered at this point in time, especially because we know or it's our understanding that the Canada Dental benefit is, has just been rolled out, not yet complete. So there's more coming, and I think they're trying to navigate what should be offered under the provincial program in light of that which is happening at the federal level.
That's it? Okay, Councilor Thompson, go ahead.
Thank you very much, Mr. Chair. So can someone tell me, please, through you, Mr. Chair, what is our process in terms of, I guess, screening young people to determine whether or not they have dental issues and so on? I'm just wondering, is there an actual screening process in place? And if so, how does it actually work?
Through the chair, thank you for the question, Councillor. Yes, we do screen all grades of elementary school, and it's part of our mandated program under the Ontario Public Health Standards. So registered dental hygienists from our program go into schools and conduct that school screening. And Dr. Mehta is here, who is overseeing and responsible for that program. So every grade does get screened from JK to grade 8.
Right. And can you tell me then, I realize, the difference between the private dental practice and practitioners and the work that public health does and so on. I'm just wondering, in terms of cost differential, what does it cost us to provide the service, and what is it the cost in terms of the private practice? What is the differential in terms of cost?
So through you, Mr. Chair, perhaps I'll start. Councillor, I don't know that I can give you an exact dollar figure. I can tell you that we do run our service as a not-for-profit service, and we have salaried dental providers, dental care providers, relative to most private practices which charge on a fee-for-service basis. So while I cannot at this point or today give you an exact figure, I'm sure we can come back with that to you on an average basis, but I would suggest to you that our costs are certainly lower relative to that which you will see in your standard private practice.
Right, and can I just unpack that a little further, please? So there's a salary component, and then there is the fee for service, whether or not it's provided by public health and or the private sector. I'm wondering if you can look at sort of that amalgam of the cost as part of your coming back to us. The reason why I asked the question, I just wondered whether or not if it's at all possible for us to look at a future relationship with respect to the private sector in order to see whether or not they could provide some service at cost, which would be equivalent to that which public health would actually bear. And I think this is in line with some of the work that the province is doing now in terms of just the surgical procedures and procedures to take place in some of the private sector hospital relationship that the provincial government's talking about, but having it billed at an OHIP rate. I'm just looking at that as a potential consideration. And I'm hoping that you can get back to me on that. But I do have some other questions. Mr. Chair, that can't be my time because I've really just started. But I wanted to ask you, Dr. Violet, if you could tell me, I'm at the Scarborough Civic Center now. There is a clinic in this building. I don't know fully when it's operational, how it operates. Sometimes there is the dental van that's here. I don't see anybody in it. I'm just wondering, how do they provide the community with information? How does one get to connect with the public health facility here? And then another component part of my question is that at the Mid-Scarborough hub at Brimley and Eglinton, in my ward, which is a United Way facility, there is dental services that's provided. Do we provide funding to that in addition to the United Way?
Through the chair, perhaps I can answer your question first about our clinic at Scarborough Civic Center. So the hours
Sure.
of operation are 8 to 4, Monday to Friday. And we did have our dental bus there for a significant period of time because we
Yes.
have such a significant backlog As I mentioned earlier, our next intake appointment is in summer 2024. And so it's a giant bus, and parking is challenging. And so we were there until the end of last month, and now the bus is parked at the Mitchell Field Community Center supporting our North York Civic Center clinic, which is undergoing some renovations. So we actually utilize the bus to help with backlog, especially when there's a disruption in service at the fixed clinics.
And if I may, Mr. Chair, just to ask or to answer the question in respect of private dentistry. So there's no question, a fee-for-service type of practice is always going to be more costly, at least in my experience. That's what I've observed in more than one jurisdiction when it comes to dental service offerings. I think it's important, though, for board members to recognize that for certain services, for certain specialized services, we will send to other dentists or specialty dentists on an as-needed basis, depending on what the treatment plan is. So it's not that there is no use of other existing dental providers out there, but certainly where we can provide the service within our own dental clinics, where that's appropriate, we do that. And on an as-needed basis, depending on what the treatment plan is, we do also make use of other services outside.
Okay, thank you. Councilor Thompson, you're
And
up
the
now.
question with so the question.
Your last question, Councilor Thompson.
Well, I've already asked it, Mr. Chair. I'm just asking for clarification. I was asking about the relationship with respect to the hub at Brimley and Lawrence. There's a dental clinic there. I'm just wondering what the relationship is.
I'm sorry, Mr. Chair, I didn't hear the relationship between us and...
There's the dental clinic at the hub at Mid-Scarborough at Brimley and Lawrence. There is a dental clinic there. I'm just wondering if that is exclusively supported by the United Way, or whether or not we also have a relationship with that facility.
Yes, I believe, are you referring to the dental clinic with the Scarborough Center for Healthy Communities? I think that's the hub location.
It's part of the
Yes.
SEC, yes.
Yes, so that is a Toronto Public Health Dental Clinic, which is funded through the Government of Ontario.
Oh, fantastic. Okay, thank you.
No problem.
Okay, thank you. And I have two small questions. One second. So one of your slides indicated that in 1 year, pre-pandemic, you saw 28,000 children, and within the pandemic, I think it was 31,000 children. So my question is, have you seen a decay among young people during that time, an increase?
Through you, Mr. Chair, what you're referring to is one of our slides when we're talking about the services that were provided pre-pandemic within our clinic settings versus that which we were able to provide over the course of the pandemic. So pre-pandemic, we roughly saw about 28,000 unique clients in 1 year. Because of the demands of the COVID-19 response and the fact that we had to redeploy staff from our dental services to COVID-19 response, during the pandemic, we saw 31,000 unique clients, and it was a matter of staffing. So we did continue to provide dental services over the course of the pandemic, but in a reduced capacity given the need to redeploy staff towards COVID response.
Okay, thank you for that clarification. And my last question is around the expansion of the dental program across the city. I know we've focused on Scarborough, but when Taibu was doing the presentation, the map showed that the hotspots were, I know it was COVID related, but there was correlation when it comes to poverty and inequities across the city. And they showed that there was a program lacking in both in Scarborough and in Etobicoke. So do we have a long-term strategy to perhaps provide services in those other areas as well?
Through the chair, thank you for the question. So we have an incredible partnership with Rexdale Community Health Center. We actually have 3 locations that we're co-located with Rexdale, including a new clinic that opened last summer, as well as with our partners at Yonge and Finch, Jane and Finch at 1 Yorkgate Mall. We just recently announced a new clinic as well in the fall there with our partners.
Okay, thank you. Those are my questions. It's time for speakers. Any speakers? I know Trustee Shrishkan Raja was passionate about asking her about making some comments. Did you want to make any comments? Do you have 5 minutes?
Yeah, I appreciate that. I'm still learning the bylaws, and I think we're up for training, so I will be looking forward to that. Yeah, no, I think we know the data's there, and we keep saying things are data driven, but obviously they haven't been, because where things are located just doesn't make sense. If we are doing a system that is based on need, and that's where these programs are expected to be, I don't see that they're where they're supposed to be. So would like to just have that in everybody's back of their mind, and how decisions have been made, where to place things, that obviously there were justifications for those that have not been transparent, in my opinion, if we claim to be data-driven. And the other just comment, I know one of the way we assess where we can place programs is based on community capacity. And so they're expected to write a proposal. But these community organizations, like Taibu, like Rexdale Health Network, which I grew up going to, are overworked. And systemically, to put the burden on them to write a proposal is just expecting them to do even more work. So if we are only basing where we place sites based on the demands that we hear, we're ignoring a large swath of the population who does not have the capacity in terms of just the capital, because they're working many jobs or they're stretched for writing other grants. So I think we need to do some sort of review on how we place sites, and not having a system that just depends on organizations to write up the proposal. And maybe that's a role that we as public health can play in bridging that. And because to me, the maps are jarring. And if it's not jarring for people, then I question our commitment to public health. We learned that through COVID. We cannot address health issues in silos. Things spread, and we all pay into one tax system that we all end up, having to pay the price for. So, thank you.
Thank you, Trustee Shrishkan Raja. Any other speakers? Okay, seeing none. May I have a mover to adopt the recommendations? Trustee Shrishkan Raja. All those in favor? Well, there's a staff recommendation. Councillor Perks. You okay? Okay. All those in favor? All those opposed? And that's carried. Thank you. So we'll now move on to item HL 4.12. I don't know why I said 4.2. 2023 Student Nutrition Program Services Subsidies. We will begin a presentation. I'll ask Dr. De Villa to introduce the presenters.
So thank you, Mr. Chair. Yes, we do have a presentation coming up in respect of the student nutrition programs in Toronto. As per my introductory remarks, this is a long-standing program within our city that serves a number of important purposes. It is not simply about nutrition, but as you will see through the presentation, a significant component of building long-term community resilience, starting off with our youth and hopefully building community leaders for the future. We have presenting today Althea Hutchinson, the director who is responsible for this program, and she is joined by one of our colleagues, Denise Vavaroutsos, who is also very active and actually a main lead for this program in student nutrition, has been for a number of years. We're pleased to have them here with us today. And I'll turn it over to my colleague, Althea.
Thank you, Dr. De Villa. I'm pleased to be here to present a program that is actually quite near and dear to my heart, which is the Student Nutrition Program that runs in the City of Toronto. So next slide, please. So student nutrition programs, this is Toronto Public Health, as my previous colleague presented. We are celebrating our 140th year And very similar to the dental program, the student nutrition program also has a very long history with Toronto Public Health. As early as 1930, Toronto Public Health was working with the Department of Education for the provincial government to provide what they called at the time forest schools. And so what we have here is a picture that depicts what a forest school looked like. And what it was is that at the time there was sort of a need identified that children were, not necessarily receiving the right nutritions, that they were underweight. And so there was this push and this partnership between Toronto Public Health, or the Public Health Unit at that time, as well as the Board of Education, to create these schools. And the schools were for, as I indicated, vulnerable or undernourished children, so that they could expose to not only food but fresh air, and also they'd receive an education at the same time. The idea for an open forest school, it came from the conviction that fresh air was essential for children, especially for those exposed to tuberculosis. So the schools weren't, as I said, they weren't just about food, they were about a lot more than food. And I think that theme will continue on as we continue to discuss the program that exists today. The classes were later used to boost the health of children who were, and this is a direct quote from the time, below par physically because of, and again a direct quote, faulty nutrition, emotional upset, or social aberrations. A hot lunch, 2 substantial snacks, plenty of fresh air and sunshine, actually a dose of cod liver oil, and instructions on health habits were also part of the program. Most students did gain weight and improve their health after 1 term in the forest school, and then they returned to the regular class. These forest schools, they actually closed in 1963, so they had a 50-year run. Next slide, please. So this other picture here, what it predicts is what our student nutrition program looks like today. So we do at Toronto Public Health continue to support and promote student nutrition to this very day. Next slide. So what is the student nutrition program? It's a universal meal and snack program run locally by students, parents, volunteers, offered mainly in public elementary and secondary schools, and also in independent schools. Student nutrition programs, they are universal. Now, that doesn't mean that all students participate in the program, but it is available and accessible to all students within the school that has a program. The student nutrition program, they offer healthy foods, and we do that to ensure that students at risk of poor nutritional intake have universal access to safe, adequate, and nutritious foods at school. Food choices are adapted to address dietary restrictions due to allergies and intolerance, as well as cultural considerations. And they help the students also to develop healthy eating habits. Student nutrition provide nutritious meals and snacks, as I indicated, giving them the nutritions and energies they need, not only to learn, but also to play. These programs also, beside the area of food, they create opportunities for community capacity building. There's volunteering and job skills that individuals who work with the student nutrition program have access to. As I indicated, they're run locally by volunteers. That includes students and parents, as well as anybody who's interested in supporting a school nutrition program. The school staff are also engaged, as well as school administration, as well as partner organizations. The one thing I would say about this is that it also creates a sense of social inclusion. So you've got a program, as indicated, it's not just about food. It's actually about much more than the intake that the food that the children do take. There was a short video that was released in 2012 that you can access via YouTube. The link is at the very bottom. And what it does, it provides you with an overview of the program at the ground level. So it's not all Toronto Public Health, but it has individuals who are engaged in the program, who run the program, and there are testimonials in there as well about the benefits that have been received, again, from the volunteers, as well as some of the students who are actually engaged in volunteering in the program and recipients of the program themselves. One point I want to note before you go watch the video is that the video was done in 2012. And in there's a note that says that we were providing, at that point in time, 140,000 meals per day, meals per day. And now we're actually being able to provide over 227,000. So a couple years later, and we see growth, which is what it's sort of a double-edged sword. You wish you didn't have to see the growth, but we're happy to see that we're able to address some of the needs. As the chair and the Board of Medical Officer of Health pointed out in their opening remarks, next slide, please. There are a lot of, positive program outcomes. I've listed a few here for you. So you've got increased attendance and school participation. It reduces dropouts. It reduces health disparities. It reduces social isolation. As I already said, job skills, training for students, and parents and volunteers is available through the program. And finally, it reduces obesity and chronic diseases. So I've basically given you that, but I'm going to give you some stats as well, as highlighted by research done by the Toronto District School Board. So in their findings, they found, and this is a research that was done from 2008 to 2010, a bit dated, but I think the numbers do speak for the benefits of the program. So better able to concentrate on class activities, reported 62%. Better performance on standardized test and math readings. So 2/3 of secondary schools showed improvement in grade 9 credit accumulation. 70% improvement in graduation rates. Reduced suspension rates by 42%. Health benefits where there were, positive health outcomes revolve mainly around the importance of maintaining current and future healthy weight. Breakfast consumption is associated with prevention of obesity and overweight. There another study that was done by the Toronto District School Board called Feeding Our Future Research. They found that 82% of students said the program kept them from feeling hungry. 72% of students said they developed habits of eating breakfast. 70% of students said that they had higher energy levels. In terms of the obesity rates and why we think this program and the impact on it is that in Toronto, 28.3% of children are considered overweight, and that's the study from 2006. Over 46% of adults in Ontario are overweight, another study from 2010. Children's eating habits, they do track into adulthood. In terms of the literacy, because we've done quite a few reviews on this, literacy shows that children should be the priority population for intervention, and prevention is a key strategy. Schools are an ideal place for interventions since children spend, over half of their time at school. Obesity does contribute to significant long-term chronic disease, including heart disease, diabetes, cancer, and mental health. So you can understand why we think a student nutrition program and the outcomes that do come from it are beneficial for the population at large. Next slide, please. What we have here, and it is quite tiny, but it's a large city that we have. So what this map is doing is it's actually depicting where the distribution of the low income measure, which is one of the eligibility criteria that we do use in terms of providing student nutrition programs. And the darker the color of blue, it's the higher the need in that particular community. The dots represent where the municipal funded programs for student nutrition programs are located in the city. And that what you also notice is that generally speaking, the majority of the student nutrition programs are located in the areas with the darker colored and blues. There are a few, you will notice, there are programs that are located in the areas that are white, which of course have, they have the highest income according to the low income measure. But they're there mostly because, these are programs that couple of reasons. One, the students who are in those, they have met the LIM criteria. So in talking to my colleague, you'll find that in the white areas, they're predominantly high schools in those areas. And high schools do draw, students not from necessarily their community, but they draw it from other areas. And the way we look at eligibility criteria within the program is that we're interested in the experience that the student is having, not necessarily the neighborhood. So that's why you will see that there will be white dots in some of what are considered some of the highest income. The other thing to note is that once there is a program established in a school, that program stays in place as long as they meet, a few of the eligibility criteria for us. We're loath to take a program away because we know that we want to continue to provide nutrition to our students. In 2023-24, for that school year, as depicted in the upper right-hand corner, it gives you, and I think this was mentioned by our chair, it's 619 school communities are going to be receiving or running a student nutrition program. That's 820 school nutrition programs in total. That means that in some of those sites, there is more than one program being provided, typically a breakfast and also a morning meal. We're going to be able to offer over 227,000 meals per day to students. Next slide, please. In terms of the investment that the municipality makes, well, we've got two focuses here. One, we want to strengthen the existing programs by ensuring that any annual costs related to inflation, that is being covered. For this particular fiscal year, the City of Toronto has provided an investment of a 5% year-over-year increase to deal with inflation. As noted in the report that accompanies this particular presentation, at the end of the day, the inflationary cost of food was higher. That became out after we had done the budget. It's unfortunate, but we are still proud to say that unlike some of our additional investors, which we speak to in the recommendations, the City of Toronto is cognizant that we do want to the best of our ability, continue to strengthen the existing programs that are in place. To that end, the municipal investment this year is $17.7 million and has already indicated providing 227,000 plus meals per day. The other thing before I move off this slide is that it would be 2019, there was a need identified for providing student nutrition programs within independent schools. So that had been a gap. There were a few independent schools who were receiving funding from Toronto Public Health prior to this expansion, but we're happy to say that, every single year we have more and more independent schools who are able to receive this benefit, because regardless of whether or not you're in a public funded school or an independent school, need is need and hunger is hunger. So we're quite thrilled that this program continues to be rolled out year over year with more uptake every single year. Next slide, please. So there's the municipal funding, and then of course we look towards partner funding. The data that's in front of you is the most complete data we have, and it talks about the 2021 investment. And in that case, our funding that particular year from the city was $16.4 million. The province did provide $11.6 million. A part of that was funding specifically dealing with the COVID-19 pandemic. And also the federal government did provide about $1.6 million in funding as well, again, very attributed to what was happening with COVID-19. The schools' student nutrition programs do receive funding from other sources. They receive funding through contributions from parents, as well as contributions from corporations through fundraising and other activities. There's also non-monetary supports that are provided, and those non-monetary supports are usually through food donations, product or equipment donations, in-kind use of space or equipment maintenance, volunteer time and effort, and I cannot go without saying that the volunteers run this program. We're ever grateful towards the volunteers who support running this program, as well as other non-monetary supports include training and expertise from our partner organizations, as well as from Toronto Public Health staff who do support the programs being run in schools as well. That all being said, there are challenges, and the challenges are generally around funding and receiving funding from other sources. And the impact of that is that when there isn't sufficient funding, or when there's a funding shortfall from being able to run a program, what we see on the ground is we see that there are smaller servings being given to children. There are fewer food groups being offered. Sometimes the programs are reduced. They're not necessarily provided daily, or they're reduced. They look at how they can make their dollar go as far as they can. The other one too that sometimes happens, that programs start later because the funding is not sufficient to run an ideal program. Next slide. So I mentioned that word ideal program, and ideal, you know, it's a word that, you know, it's an interesting word that we've chosen, but I do think we put it forward out there because we are providing $17.7 million this year. But in terms of the number of student nutrition programs that currently exist, when we do a calculation, it's an estimate. It's based on the number of students who are participating in the program times the number of school days times the average cost of a meal or a snack. The total funding, or the ideal funding for this program in this particular year, would be roughly $100 million. And that's for the existing programs. Every single year, we do go out and we gather information from the existing programs, and we also do a call out for other schools. And unfortunately, in the 2023 application year, we saw a growing need. Some of it is, you know, predicated on inflation costs and the impact that inflation is having on family households, but also COVID-19 was a stark reminder of just how inequalities exist within, unfortunately, our city. And what we saw in 2023 is we had 29 applications for new programs for new sites that would have covered 12,000 students that we were unable to provide funding to. We also saw 20 of our existing sites asking for additional programs to provide in their schools that would have resulted in about 4,000 meals per day. The total cost of that, the ideal cost for that particular program, would be, just have to flip the page, around $16.5 million. That would be everybody contributing towards, that would be the municipality, the federal government, the provincial government, you know, fundraising, and, donorships from corporations. So what this basically says is my last bullet point here. More investment is needed, particularly from the other orders of government. Next slide, please. So to that end, in our report, we did provide 2 recommendations to the Board of Health as well as the City of Toronto, and that's basically calling on the federal as well as the provincial partners to invest in schools, the school nutrition programs. An investment in these programs is an investment in our children. It's an investment in the future. I like to think it's an investment in everybody in this room as well, because the ability to ensure that our students are successful is actually beneficial for society as a whole. And on that note, that ends my presentation.
Thank you, Althea and Denise. But before we go to questions, we do have 2 deputants. Thank you. Stephen Mensah, Executive Director, Toronto Youth Cabinet. You know the drill. You have 5 minutes, Stephen.
All right, thank you very much. Hope everyone's doing well. First, I want to thank this board for endorsing our mental health joint statement at the last Board of Health meeting. As we saw, the government took steps to address some of the recommendations in that statement, although there's obviously more to do. Today we'll be speaking on food insecurity. Last week, the Toronto Youth Cabinet, we put out a joint statement in partnership with all of Ontario's 4 major teacher unions, Ontario's food hunger relief organizations from Daily Bread Food Bank, Northern Harvest Food Bank, Feed Ontario, so on and so forth, as well as national organizations such as Food Banks Canada, Second Harvest Food Rescue, so on and so forth. And we really sent a clear and unified message to the province of Ontario that they must create and fund a universal free school breakfast and lunch program to ensure, once again, no child goes hungry. And we also went further to request that the province must also guarantee that schools are provided with the sufficient infrastructure, resources, and funding to hire and train staff who will be responsible for preparing these nutritious meals. So I think in this comments, I just want to really reiterate the report and the presentation and just the direness of the situation. I had an opportunity to tour and visit a student nutrition program 3 weeks ago. It was in the west side of the city. feeding, preparing the meals for the children. I was basically that volunteer for the day to really see firsthand how the program operates. And thankfully, the location I was at, I'd say, was an example of a, I guess, quote unquote, good operating student nutrition program. They had good volunteers, consistent volunteers. They had the right infrastructure for the most part, so on and so forth, to really ensure that they were able to support the students. But as I was talking to one of the student nutrition volunteers, I asked her for her wish list, because I know the same day I had a meeting with her, I had a meeting in the afternoon with the with the education minister, and she gave me her wish list, and she said for her it was important to ensure that infrastructure or funding was provided to have infrastructure to provide the 3 food groups, because even her school, if they were to have a universal lunch program, they would not have the infrastructure to prepare the meals, and they would have to contract it elsewhere, which we know incurs and adds extra cost. And obviously her main wish list was to ensure that she was paid, and I think for me that was a big one too. No one should be doing that work for free, especially after she really broke down the process. She would have to go get the bins, sanitize the bins, put the 3 food groups in the bins, take the food to the classes and deliver it, wait for it to be brought back so she can sanitize it and clean it, and after delivering she would prepare for the next day, and she would also have to be responsible for contacting vendors and waiting for the food to come. And when she was breaking down her whole process of how she goes about it every week, that takes at least 5 to 6 plus hours a day to ensure, once again, that she providing the food and meals for students, and no one gets left behind. So I really hope, once again, to reiterate the sentiments in this report and to really express the direness of the situation. I think with the release of our joint statement, one thing I would say was the unique piece of it was many of the advocacy on student nutrition programs has been towards the federal government. I feel like we've not seen much movement or advocacy towards the province, and I am optimistic that from last week's statement and from the couple of next steps that the Toronto Cabinet will be taking to push the province, hopefully we see some movements. In response to our joint statement, province announced an extra $1.1 million towards student nutrition programs. Obviously, we know that's not enough, so I think that's like pocket change, but I do hope as we continue to apply that pressure on the province and show them that, people in Ontario are paying attention and are, speaking out, that the government needs to take these steps. So I know the clerk, thank you, have sent the joint statement for everyone's review, and yeah, so I'm glad for the presentation. Hopefully the city can, and I have an amendment that I believe a couple of councils will be putting forward, calling for the Board of Health and City Council to endorse the TYC statement, calling on the province to implement universal free school breakfast and lunch program, because I do believe we need to really reinforce and add more pressure on the province, as much as we are focusing on the feds, and I know the feds have indicated some type of movements, but I do believe we can see some movements from the provincial side as well. That's my comments. Thank you.
Thank you, Stephen. Any questions for the deputant? Okay, seeing none. Thank you, Stephen. The next deputant is Talia Bronstein. You have 5 minutes.
Thank you. Thanks for having me here today. And I just want to acknowledge the Toronto Youth Cabinet for their incredible work on this issue. A tough act to follow. Note to self, don't speak after the Toronto Youth Cabinet in future deputations. But they've done an amazing job of bringing awareness to this issue, and I thank them for that. So, my name is Talia Bronstein. I'm the VP of Research and Advocacy at Daily Bread Food Bank. We are a member-based organization representing close to 200 food programs across the city, including food banks and meal programs, and drop-in meal programs. And I'm here to express our support for the report tabled today by the Chief Medical Officer of Health on student nutrition programs. According to the latest Canadian Income Survey, 1 in 4 children in Ontario are now in food insecure households. There was a small dip in child poverty and food insecurity during the pandemic as a result of COVID benefits, income benefits, but now that those have been eliminated, food insecurity and poverty rates are now higher than they were pre-COVID. At food banks in Toronto, we see this firsthand. 28% of the people we serve are children. Food bank use has been rapidly rising due to incomes not being able to keep pace with the cost of inflation, as well as ever-rising housing costs in the city. In fact, in March alone, we saw 270,000 visits to Daily Bread member agencies, shattering all previous records and representing a 4-fold increase compared to before the pandemic. Where we used to serve about 2,000 new individuals a month, we are now seeing 12,000 people make use of the food bank for the very first time each month. To put it bluntly, things are not okay. Research shows that food insecurity among children is associated with a host of health challenges, from higher rates of asthma, diabetes, heart disease, and mental health challenges. School food programs are facing the exact same pressures that we are at food banks. More people are in need of food supports, but at the same time, it's more costly to operate these programs due to inflation. School food programs are an important way to ensure all students have access to food to fuel their body and minds. The research is clear that when students have access to meal programs, they have better outcomes at school. We fully support the city advocating to both the province and the federal government to do their fair share. Inflationary increases are critically important, especially right now while inflation is so high, but they're also not sufficient to meet the level of need. Like food banks, school food programs rely on the support and generosity of the community to function. While we're lucky to live in a city where the community steps up time and time again, this is not a reliable source of funding, nor in terms of labor. And it's certainly not equitable across different schools who have different accesses to resources. We need dedicated, sustained government funding for these programs. At the same time, while community food programs like food banks and school food programs are important to addressing people's immediate need for food, they do not address the root of the problem. This may sound strange coming from a food bank, but the answer to food insecurity is not food, it is income security. Evidence from Proof, the leading Canadian food insecurity research institute at the University of Toronto, has shown that the Canada Child Benefit reduced the severity of food insecurity among children in Canada by 1/3. Other research has shown that when you compare families with children under 6 to families with children over 6, those who are receiving the higher Canada Child Benefit for those under 6 had a lower probability of food insecurity, indicating again that a higher Canada Child Benefit directly reduces food insecurity. So I think it is important that we should talk about school food programs today and their benefits, but I also think we need to look upstream and we need to talk about how are we going to prevent food insecurity from happening before it happens. So therefore, I would like to respectfully suggest an amendment, which I will be looking to a member to bring forward today, that City Council, when requesting from the federal government details on the progress towards the national school food programs, towards the national school food policy, also inquire about whether the federal government is willing to increase the Canada Child Benefit for the lowest income families to reduce the growing prevalence of food insecurity. If we want to prevent food insecurity, we need to look upstream and make sure that all families have access to adequate income supports and affordable housing. Thank you for having me today, and I'm happy to take any questions.
Thank you for coming today. Any questions for the deputant? Okay, seeing none, thank you for coming in.
Thank you.
Okay, we could have the presenters back, our staff. You do have one question so far from Councillor Bravo and Councillor Roy, Director Roy. Okay, we'll start with Councillor Bravo.
Thank you, Chair. I'm going to focus my questions because I know that some of my colleagues will be addressing some of the other comments that were made by deputants. I just, want to start by saying that I love this program, and I know that's not a question, but I guess my question is it accurate that if Canada had a national universal student nutrition program, it would bring in one of the most radically useful population level health interventions to improve health outcomes in this country?
So through the chair, briefly, yes. This is a program for which we are strongly supportive because the evidence supports it. Yes, from a nutrition outcome and from the many other program outcomes and benefits articulated by Althea in her presentation.
Great, and would also put us in line with most of the world. So
Yes, through the chair, to my knowledge, unfortunately, we are certainly behind when it comes to providing a national school food program, no question.
Thank you. In terms of kind of focusing in on if it were universal, how would that ease the administration of this? And in generally, if there are nationally funded programs, are parents and guardians expected to fundraise for them? I'm not sure if you know that. I assume there's significant administrative costs with all the different interventions to cobble together a program, and I guess I'm asking about how this, scaling this up could actually give us a lot more bang for our buck and help parents focus on other stuff.
Thank you for the question. Through the chair, I think you make an excellent point. There definitely are, I'm going to use an economic term, economies of scale that can be achieved when you have a larger, more universal across the country program. I think that generally speaking, when you take a look at these types of things, you do achieve administrative efficiencies in that. But one of the things, and I'm sorry, I do not remember the gentleman's name that he made a comment about, and as he was saying it, I thought, that is a very salient point for us, is that it isn't just about the actual food that's being delivered. One of the things that we certainly have seen, or at least in my time with the program, Denise, much longer, is whether or not the infrastructure is there. So they can bring in a program and it's going to be great. They're going to deliver it into a school, but the school doesn't have the appropriate equipment to actually, really benefit for some of these economies of scale. They're not going to have the fridges. They're not going to have the prep space. So it's the program itself, I think, has to go beyond just looking at, the food that's going to be purchased. But if we want something that's very successful, it's got to look at the entire program and getting all the administrative things that need to be in place for it to be truly successful.
Yeah, thank you. And I also was going to ask about that very point, because if we had federal funds, we could build the infrastructure that would be needed on site at school, given that the education funding formula doesn't allow for that for provincial funding. So thank you for anticipating my question. And I guess my last question is around the principle of universality. This is something we've talked about before. I know that that there's consistently not barriers that Toronto Public Health would like to impose, but the administration of the program done within the school settings. Is it accurate to say that parents or guardians still have to provide permission, and that could constitute a barrier the way that it's administered now?
So thank you for the question through the chair. Again, it's an excellent question. I know that we did have some previous conversations about whether or not parents have to provide permission. We're still looking into that. One of the things that, in discussion with my colleague Denise here about how programs run on the ground, is that parents do have to, when you're engaged with their children, parents like to make sure that, they have an understanding of exactly what their children are being offered within that school setting. So our preliminary thought was that perhaps that's what's happening, is it's more about an awareness, because you don't want to it's very, parents get upset sometimes when they're not quite sure what their children are engaging within that school setting. But we take your point, and we are doing some additional investigations.
Great, thank you. And I will be bringing a motion, but I think it's important to note that the parents that sometimes are the least able to sign permission forms because of the pressures they're facing have their children are the ones that most need the program. So thank you.
So if I may, Mr. Chair, I just want to echo the importance of the principle of universality and how much we value that, recognizing that the evidence supports this as well. We know that unless the program is universal, what happens, or if the program isn't universal, let me try it that way, what unfortunately happens is that those who are most in need of the program do not take advantage of the program for fear of being stigmatized. So as far as we're concerned, universality is a must as part of the program, and it's a value that we adhere to and that we encourage our partners to abide by as well.
Did I break it? you. Next on my list is Director Roy.
Thank you, Chair. First of all, this is outstanding what Toronto Public Health does with Student Nutrition Program and has been doing forever. I've been following this file for over 15 years now. Couple of quick questions I have is one, do you know if we have a universal school food program in every school in Toronto, what does that cost? Have we figured that out?
We would definitely have to bring that back to you. We
Okay.
can do the calculation for sure, and we can bring that back to you.
Perfect, thank you. And the second question I have is, when I was doing some digging online, I realized that the provincial government haven't increased their funding since 2014. Is that a correct statement?
Through the chair, yes, that is a correct statement. Their base funding has not increased. They did provide some one-time funding during COVID, but yeah, their base program has remained flat.
Thank you. I'm going to bring a few motions and I'm going to speak about it later on. Thank you, though. Great.
Okay, thank you, Director Roy. Next on my list is Director Ozode.
Thank you so much for that presentation. And I love food. I think many of us here too. As someone who didn't grow up in Canada, I grew up in Nigeria, I think it's a massive blessing and a privilege that we even have programs like these. So Director Simon Roy had just asked about funding. And as I was going through the agenda, I'm curious, what will the absence of the funding or absence of the matching of the funding from the province mean for this program, especially in areas of the city like in Scarborough or Etobicoke North, that has a lot of underserved needs?
Through the chair, thank you for the question. It basically, to be quite blunt and frank, it means that there will be no program. That's the trust struggle that we have right now. Even though we do receive annual increases for the municipal funding, it's just to cover off inflation. That's it. There is no ability for us at this point to actually expand to meet the growing needs. And the growing needs, I think you speak to, I think even recently when we went through the 2023 application process, there were a few schools who came back with higher student numbers. And it was a result of the migration of individuals from the Ukraine. So, when if you're in a school that has funding, we're able to support you through that growth. However, we do have, other parts of the city that you saw from the map that we put where there are darker areas where there are no dots. And that's exactly what it is. Without adequate funding, it means that somebody doesn't get the program.
Wow. Thanks for that. And at the beginning of your presentation, I saw all the correlations with programs like this program to students' mental health, concentration, chronic disease, obesity, diabetes, things like that. So would it be fair to say then that in the absence of this program, or in the lower capacity of these programs, all those indices are going to get worse down the line?
So through the chair, again, another excellent question. I think anecdotally, I could say yes. Of course, we'd have to see. This is a very complex thing. We know that these programs do support better health outcomes. I don't know that I could say that, definitively made that comment, but I would say, generally speaking, I think your premise is correct.
Okay. And so what would the strategy be then in the absence of funding for this program? Are there ways to, prolong the program with some of the funding that we already have? Or are we just hoping that, once this, the funding cycle that we just got, expires, then we'll just have to keep making the asks to the province or to the federal government?
So through the chair, the funding that we do have from the municipal, it is an annual amount. So next year, when I talk about a registration program, what we're actually doing is just verifying how many students are in the program and trying to calculate exactly how much money goes to each program. Now, the gap that we're really looking towards is to make sure to provide what I call the ideal investment, so that, student nutrition programs don't have to make some of those difficult choices, which one of the previous speakers spoke to, about, maybe decreasing the number of meals or the quality of meals or the amount of food. So that's what that slide is sort of representing. How much money would it be so that that could be provided? So every student within the existing programs, not including the ones that we are not funding, that they themselves will have, access to the most nutritious food that bring them the best outcomes.
So through the chair, if I may add briefly to Ms. Hutchinson's answer, there's no question that expanding the funding we talked about, what would be required to provide an ideal program, if you will, for the existing programs. And I believe we've undertaken to the board to come back with what a more fulsome program might look like. But within the allocation of funds that we have, we certainly work with our program partners to provide as best as possible, nutritious food options in as cost-effective a way as is humanly possible within the existing envelope. That being said, having a more fulsome universal type program, as you heard through the earlier answer, would allow for some savings in respect of application processes and savings in respect of administration. Hence, where there are opportunities to save, we try to take advantage of those as much as possible, while at the same time ensuring that as nutritious food options as are available are provided to the recipients of the program. And again, that's meant to be a universal program for all kids who are in attendance at schools where a program exists.
Sorry, you're on the list, but Trustee Sriskanaraja, you're next.
Thank you. Through you, Chair. Thank you for that presentation. Of course, like probably everybody here, full agreement of a universal student nutrition plan. My question, I know you mentioned that we're feeding more kids now, and I just wanted to know, you cited the number in 2012. I just want to know in terms of the percentage of growth, in terms of how many we're actually feeding, compared to the increase in percentage of need, and have we been able to keep up?
Through the chair, I don't have those numbers readily available. We can certainly go back and calculate it. I would say, though, generally speaking, we're not able to keep up with need, which has been outlined in the report, because we did have 29 new sites or new programs that were requested that we were not able to fund. And then there were 20 expansions in existing programs that we were unable to fund.
And through you, Chair, in your advocacy or the advocacy with the province, or at least your sentiment you're getting from the province, do you find that there is perhaps less interest now with the announcement of the Fed's promise for a potential student nutrition program?
Thank you for the question, through the chair. The province has undertaken a program review, which is initiating this year, which demonstrates to us that they are interested in what is happening, how's the program operating from the provincial perspective, what are some indicators on how they should be moving and changing that program in order to respond to the need. So we're anticipating some outcome and direction from the province.
Okay, thank you, good to hear. And my last question is, I know there is a review for the 3 independent schools, or the potential independent schools that could be added to the list. Is there a place where I can find the names of the 7 that we already fund?
So through the chair, we actually don't publish the names of the schools as a matter of course. But I'm not sure, do we actually? Sorry, 1 second. Let me just confer with my colleague for one moment, please. So my colleague has corrected me. And it is posted, just not hosted on our own website. It's posted on the SNO Toronto page. So what we can do is provide that link to the Board of Health.
Thank you. And to follow up on that through the chair, so I know we're in the process of, or you're in the process of assessing the 3 new applicants. Are those criteria the same that we used for the 7 that we already support?
Through the chair, yes.
Okay, thank you. That's all for me.
Thank you very much. Next on the list is Director Zhao.
Thank you, Althea and Denise. So my question is just related to independent schools. Is this basically referring to private schools where the parents pay tuition for their students to go?
Through the chair, yes, the independent school is just another term for private schools.
Do they get less funding or the same amount of funding as all of the other public schools out there?
In terms of funding as a school, that's not something necessarily that we're involved in, but in terms of funding for the student nutrition program, if they meet the eligibility criteria, which is based on the LIM indicators and the level of need demonstrated in that school by the students attending the school, then they do receive an equal proportion similar to the amount of funding that other programs get from the municipality. Same proportion.
Through the chair, just to be clear, even with the independent school program, funding for the student nutrition program is premised on need. So they're assessed at the same level because need is need regardless of whether you're going to an independent school or a publicly funded school.
I see. And then I guess the one last question I had around that is if you were to introduce kind of like a provincial-wide fundings like for students to have nutritious meals, will there ever be like potentially like a copay with certain parents in higher income neighborhoods at all, just to help kind of offset the costs of all of this?
So through the chair, difficult to know what will come of the provincial program review and what the province will decide in terms of its program. I think the notion here, though, is that, and what the evidence supports, when we look at student nutrition programs and that which the evidence supports, one, the benefit of actually ensuring that children are getting adequate nutrition in order for them to, one, experience good health and to participate fully within their educational experiences, and two, that when you have these programs, that they're made universal to everybody attending the school, such that there isn't stigma attached to participating in the school nutrition or the student nutrition program. So what the province determines as part of the review, we'll have to wait and see. But certainly having a universal school food program is supported by the evidence. How it's administered will be a question for those who are administering the program.
Okay, thank you. And Councillor Malik, you're next.
Thank you very much. I appreciate the presentation. I see a budgeted 5% for food inflation in 2023, but some reports are stating it might be twice as high, and we're definitely feeling that right across the board. How will the inflationary cost of food affect the student nutrition program this year and moving forward? Excuse me.
So through the chair, thank you for that question. When we're preparing the budget, we usually start around this time of the year. Last year when we were looking at it, and we actually use a methodology called the Nutritious Food Basket, and that's a report where Toronto Public Health actually goes out and sees on the ground what is the impact in terms of a bundle of goods versus another bundle of goods and what that is, and we bring that forward as the increase. But last year, we did not complete that for various reasons, and instead what we used was at that moment, what was going to be the projected increase for inflation on food. Unfortunately, what we saw was that it was not enough. The budget for 2023 is closed. What we'll be doing in this coming budget period is that we will be revisiting what the budgetary inflationary impact would be. So coming into the 2024 budget, we will definitely be putting in an increase to address the, the cost of inflation.
So in terms of practical impacts on the program this year, what are we looking at?
I did speak to this, through the chair. I did speak a little bit about this. From practically what we've heard in having these discussions through our partners is that schools have to make some difficult choices. And those choices could be whether or not they provide a smaller meal portion, whether or not, they don't provide as, start their program later. But those decisions about how they will address that actually happens at the local level, which is something that we appreciate because the principals and the school administration best understand how to address these needs.
Thank you. It's been mentioned already this morning that the number of students taking part in the program has been increasing year over year. Can you, and sorry if I've asked this, but what percentage of Toronto students now take part in the program, and kind of what is the ultimate goal?
Again, that is a number I don't quickly have at my hand in terms of the total percentage of students who participate versus don't. We can bring that back. The ultimate goal, of course, would be is 100%. That would be the ideal thing that we would have. We would have a program not just in Toronto, but across the entire country.
In the report, you state that one of the operating pressures has been the need for single-serving products during the pandemic. And prior to the pandemic, schools were working towards waste-free lunches. And from a public health perspective, have we reached a turning point in regards to needing prepackaged foods like that?
So through the chair, we're certainly we would encourage the reduction on the reliance of prepackaged foods as much as possible. Again, partially from a nutrition perspective and partially from a cost perspective. So these are the kinds of things that are often balanced out at the local level, exactly as Ms. Hutchinson was saying. But certainly we provide some advice in respect of how best to try to stretch the dollars where we can. And I know that certainly programs share insights with each other as well. And our colleagues at Student Nutrition
I'm just
Ontario.
asking on a public health perspective. So the drive to this was because of the pandemic. So
Yes.
now are we in a different place where it's not necessary or required? I mean, the choices will have to be made.
Yes.
But do we still need it, I guess, is what I'm asking.
So, at this point, through the chair, less so. Again, I don't know all the specific and unique circumstances in every program, whether kids are still taking some things home, for example, which requires prepackaged foods. That was often the case within the context of the COVID-19 response, the more active phase, that kids were actually still participating remotely and would take some products home. And prepackaged, obviously, is much easier in that case.
Thank you. And for those at home and in the room, we have with us Dr. Singh, Dr. Krishner, and Councillor Mantis and Thompson on the line. And they've been there for a while. I just wanted to acknowledge that they are with us. And Councillor Thompson does have a question. So go ahead, Councillor Thompson.
Thank you very much, Mr. Chair, and thank you to the staff for the presentation. And I asked the question because this has been an issue for as long as I've been a member of council, and it continues to be an issue. I recently read the Hammer and Hawke study out of University of Waterloo, and they talk about Canada being the only G7 country without a national student meal program. It also goes on to say that only 5% of students in Canada participate in a school meal program. So I guess my question is, given the necessity and given the need for a national program, and we look at places like Korea, France, and other countries around the world that offers a program, I'm wondering what is the strategy that's necessary in order to affect changes on the national level. When we were having a problem with respect to funding municipalities with respect to GST and the gas tax and so on, we launched a program through FCM, and that basically was very helpful. I'm just wondering, and Dr. DeVille, I guess this is for you, the question, what could we do more that we're not doing now with respect to getting other municipalities across the country to participate in an initiative to get the federal government at the table to realize their responsibility?
So through the chair, I don't know that I have the definitive answer to your question, Councillor. I would suggest a couple of things, though. One, certainly it's not a lack of interest on the part of other municipalities. I think there's quite a bit of interest looking at Student Nutrition Ontario and the various partners there in different regions. There's certainly interest, no question. We were hopeful, I would say, as a public health community, when in the 2022 federal budget, there was a commitment towards developing a national school food policy. There was a lot of optimism around that, given that it was specifically within the 2022 federal budget. And you'll note that one of the recommendations in the report in front of the board today is to actually ask the federal government for what is the latest in respect of that policy. We're hoping that there's some money that comes behind that and a real will towards implementing a national school food program, which, as I've mentioned already, is evidence-informed, both in terms of immediate or short-term health, but I would argue as well in terms of long-term health for the future citizens and leaders of this country.
Thank you very much for that. This is just to staff in terms of your presentation. And I'm not sure if I'm going to be critical or that I'm just simply perhaps asking you, when you prepare these decks for presentation, maybe perhaps additional choice of words and or colors could be utilized. And I'm going to pick at it a little bit. In the presentation, I think if my memory serves me correctly, you talk about the blue box areas and the varying dots that were spread across the map. But you also reference the white dot areas with the blue dots, and which seems to equate the white dots with rich and I guess much more economic benefits associated with those areas. I'm wondering if, as part of your presentation going forward, if there could be another way in terms of making these presentations, because then we get back into this reflective position of whites and the rationale of richness and so on that's associated with that color schematic perspective based on your presentation.
So through the chair, we're certainly, open to receiving your feedback. We will take that away in respect of presentations. I think there's always an opportunity for us to improve in respect of data visualization and in presenting the data around health situations and other phenomena that we're reporting on to the board in the city in as meaningful and as appropriate a way as is possible.
Thank you. Thank you, Mr. Chair.
Thank you. I do have a question, a short one. Might be a statement, I'm not quite sure. But so the city, is putting $17.7 million into the program, a 5% increase every year. The province in 2021 put $11.6 million into the program, and in 2023, the province put $8.5 million into the program. So we're adding, as a city, to the program, and the province is reducing their commitment to the program. Have they given us a reason as to why that's happening? I mean, the need seems to be growing. Food inflation is going up.
So through the chair, the $8.4 million is the static amount the province has been providing for many, many years. The difference in the increase that you saw in 2021, it was just for COVID-19. So they recognized that COVID-19 was having a significant impact on the student nutrition programs. So they provided that additional amount as one-time funding. So they did remove the COVID-19 one-time funding, which is sort of commensurate to some of the other benefits the province had brought on to deal with COVID-19.
So does the province believe that COVID is over?
I cannot speak on that.
That's rhetorical. That's rhetorical.
We'll take that as a rhetorical.
Okay. And so the Daily Bread Food Bank in their presentation stated that 20% of people who use food banks are students. So, yeah, shelter. Was it food? Yeah, food, shelter.
Your children.
So how do we fill that gap? Like, where's the gap here? It's a difficult question to answer.
So through you, Mr. Chair, I think that's why you're hearing us advocate for a more fulsome student nutrition program. And this is not a new position for Toronto Public Health. In fact, it's one we've been on record with for many, many years now. Also, we have been on record in respect of the social determinants of health and how important this is. I think we heard from our colleagues at the Daily Bread Food Bank that ensuring income security is actually the more definitive method by which to ensure food security. And certainly that has been something that we have spoken at length about here at this board. Yes, during this term and in the many terms preceding this. In fact, I think it's part and parcel of our 140-year history at Toronto Public Health, advocating for appropriate income, appropriate housing, and all the other social determinants of health as important components of that which gives rise to good health.
Yeah, thank you. One final question. I know that you've stated that we need $100 million to fund the program fully. And right now, looking at this, it looks very piecemeal. 17.5 million here, 8.4 there. Has public health in its history ever asked for a 1/3 between the city, the province, and the feds at any one point?
So through the chair to the chair. When the program was originally established, the student nutrition program, its current iteration, particularly when the expansion, there was a report that was brought to the Board of Health, and it had a funding formula that called 1/5, basically 20% from 5 partners. One of them being the municipality and the federal government, the provincial government, fundraising corporation. So that was put forward, and that was endorsed by, a previous Board of Health as being, a funding model. If the Board of Health were to decide that they wanted to put forward a different kind of funding model, that was certainly proposal, I suppose I should say, rather than model to the province. That would be at the board's pleasure. However, I do want to note that, our recommendations, particularly the one with the federal government, if they were to follow through and provide a fulsome program, it would be problem solved. So that's why we put forward the recommendation, because they did make a commitment through a budget, and we're looking for them to honor their commitment at this time.
Thank you. Those are my questions. And I was the last person to speak, so we'll go to speakers. I think Councilor Bravo was first. Okay. Director Roy.
Thank you, Mr. Chair. I think in 2023, spending an hour and a half in the biggest city in a country like Canada and speaking about student nutrition, it's kind of ridiculous.
Director Roy, you have to move your motion first and then speak to it.
Oh, I have to move the motion. Which one?
Whichever motion you have.
I've got a couple. Okay, sorry. So motion A, let's go with that one first.
Staff will put it on the screen, and then you can speak to it. One moment. Jamie, go ahead.
My motion is that the Board of Health amend recommendation 3 by adding the words and inquire about whether the Government of Canada will consider increasing the Canada Child Benefit for lowest income families to prevent growing child food insecurity. So the whole thing reads, the Board of Health and City Council request the Government of Canada to provide details on progress towards their 2022 federal budget commitment to develop a national school food policy and to explore how more Canadian children can receive nutritious food at school, and inquire about whether the Government of Canada will consider increasing the Canada Child Benefit for lowest income families to prevent growing child food insecurity. So that's one. Should I do the second one as well together?
Go ahead.
The B, can we put the B up on the screen, please? Thank you. The second motion is that the Board of Health recommend that the City Council request the Province of Ontario and federal government to fully fund breakfast and lunch programs universally available in all publicly funded schools in the City of Toronto. And the second part of that is that the Board of Health and the City Council endorse the joint statement on addressing the rising food insecurity facing children and youth in Ontario in the submission provided by the Toronto Youth Council on May 24, 2023, to the Board of Health requesting the provincial government to provide a universal free school breakfast and lunch program to all Ontario students.
Okay.
Now I can speak?
You can speak too.
Perfect. Thank you, Mr. Chair. As I was saying, we spend an hour and a half in the biggest city in a country like Canada to talk about childhood hunger, childhood poverty, and access to food. In Canada, food is a human right, and we signed off on that 50 years ago, and still we are talking about the same thing. We know that investing $1 in a student nutrition program shows a benefit of $5 to $7 on health, economic, and education costs. It's one of the best ROIs I've seen in a long time. We have also noticed, and especially nowadays, schools from across our city reaching out to food banks asking for food hampers to give to their parents. That is not the job of food banks. That is absolutely not the job of principals to ask for food hampers so the parents can feed their kids when they come to school. That's irrelevant. We have failed as a society. In the beginning of pandemic, my child, who was in kindergarten at that time, had online classes, and I decided to sit into one of them. After it was a 1-hour class, and after the class got over, the teacher asked everybody, what is the plan for the rest of the day? And every child was talking about how they're going to go in the backyard and play. And one child, who I know, my neighbor, stood up and said, today is the happiest day in my life. And of course, the teacher got excited and said, why, what are you doing? And he said, my parents can finally get some food from the food bank. The food bank is open. Mr. Chair, we have failed as a society if that is what's happening. Sorry, I choke up because it's very close to my heart. So I really urge that we support these motions, and we ask the layers of government that everybody needs to do their part. We know that the City of Toronto Public Health is doing their best. We now need the province and the federal government to step up. Thank you.
Thank you, Director Roy. I think Councillor Bravo has a question for you. Oh, you don't? Okay, any questions for Director Roy on his two motions? No? You do? Yes. Okay. Councillor Bravo.
Thank you, Chair. I have a motion. The first part I'll be speaking to a bit more once it's up. The second part, I think, has been more ably accomplished by Director Roy's motions, and I will be supporting both of those. And I want to thank you for bringing the sense of urgency and grounding these motions and this work and the real experiences of our neighbors. This is happening in every part of the city. every day, and it's intolerable. It's intolerable to all of us here. While the motion comes up, I'll continue to speak about this. You know, Canada is an aberration when it comes to public health interventions in relation to universal student nutrition. We're the only OECD and G7 country to not have such a program. My motion essentially reaffirms the principle of universality. I worked with staff on this. What I really want to get to in this term is something that's a bit more forceful, which is that we figure out a way for the administration of these programs within the school system. While we're on the road to universality, they are not universal because of the requirement of parental or guardian permissions to participate. And so, like you, I've known this situation being for 20 years in elementary schools as a parent who's a leader, and as someone very involved in the Toronto District School Board Intercity Advisory Committee, knowing that the child whose parents did not sign the form for whatever reason, whatever circumstances they're facing, it's really challenging just to keep up with the forms in school. That child may not be getting food, but hasn't had breakfast, didn't bring lunch. Sitting beside my child, whose forms I did sign, and who had a breakfast and has lunch and is getting snack. And so that creates a situation of super disadvantage, super exclusion. And I know that that's not in the intention of Toronto Public Health. So I think we need to continue to investigate, as the medical officer of health has said, how we can get to a place where we use a negative option billing, which was so ably tried by the company affiliated with our former mayor. It works for companies to click here if you don't want to receive this message. Why can't we just click, why can't we just say, sign the form if I want my child to be excluded? There's an additional layer here where it's often you get the letter at school that says, please donate to the Toronto Foundation for Student Success or the other foundations. And for many parents, that's seen as, I can't contribute $25. And they misunderstand and think that they don't, therefore they're not eligible to participate in the program. And of course that excludes the very people that we're trying to help here. If it's English as a second language household, for many, many reasons, it compounds the exclusion and the disadvantage. So this is just the beginning, I hope, where we really dig into this. And obviously what we need here is to get on the road to universality. As we heard Dr. Davila say in the answer to questions, this would be a game changer in ensuring that we have more equitable health outcomes in this country. And in the city where it's the most unequal city in Canada, where inflation is impacting people in so many different ways, where a child, like you said, Director Roy, the best day is when parents can go to a food bank. That is something that we really need to lean into and address. The advocacy, the strong voice of the Board of Health and Toronto Public Health in saying that the federal government must come into the community of nations that actually recognizes how essential this is absolutely essential. 83% of countries in the world have a universal school-based nutrition program. That includes countries that are very, very poor by comparison in terms of their GDP. So this is really just a question of political will and investing in the things that actually keep us safe, make us grow, contribute to a better society, and we have to get there. So I'll be supporting your motions, and I thank you for putting them forth, Director Roy.
Thank you. Any other speakers? Go ahead, Director Ozude.
Thank you, Chair. And very briefly, as we've been having the conversation, I was thinking about all the issues that affect young children, youth, and of course, mental health is a very big one. And I was curious to see if there's maybe correlation between food insecurity or school nutrition programs and mental health, and there is indeed a correlation. And so I will be supporting this motion. And as someone who's had some, mental health struggles in the past, and who know youth who are having the same problems, I think an investment in, in this program is also an investment in not just the, the food and the sustenance and attention that kids bring to school, but also in their mental health. Thank you.
Thank you. You already.
Slight change in the motion.
Yes, I received that. Thank you. I think Councilor Thompson has had his hands up.
I did. Am I able to speak now?
Yes, you may. Go ahead.
All right. Thank you very much, Mr. Chair. Mr. Chair, I'm going to support the motions that's been put forward. I think that there is a real need for us to have a greater conversation and efforts to this subject matter, which is extremely important, certainly for children, but for our nation's survival, because as the expression goes, children are our future. And what do we do and how do we invest in the children in simply, ensuring that they have healthy, nutritious meal on a daily basis, where they go to school to learn, to negotiate, and to learn to be leaders in the community and future leaders beyond. It seems to me that, and I think we all recognize this, that our country as a whole does a very poor job with respect to helping and providing appropriate nutrition for our children. There are parents who can't afford to provide nutrition and the things that their children need, but we know that there's a large number of parents who are not able to do this. And they are in fact working, and they're relying on all types of support, which is not sufficient. But as a minimum, when our children go to school, they should be able to be fed appropriately, a meal in the morning and a lunch meal, a good, healthy meal on both those occasions, and snacks. I think it's something that's important for us to recognize as a whole. And of course, we've been talking about it now. It's been stated for a very long time. And I think we really need to take an active approach. But I don't think it's just going to be a made in Toronto solution. And as I've heard Dr. De Villa has indicated, that all other municipalities are mindful and are aware with respect to the educational system and schools and so on. Like the approaches that we took years ago when I was on FCM, we fought for the gas tax contribution to cities and municipalities. We did the same for the GST, and there's a long drawn out process, but it was successful, and today it is commonplace within the makeup of our budgets and our contribution to transit. And in municipalities where there are no transit system, it's for infrastructure, bridges, community centers, and so on. I use that simply as an example. And if you read the Hammond and Hawk study around this subject matter, it's frightening actually that more is not being done. Of course, there's a lot of attention now that's being given to greenlight our approach to affect change. All of us are responsible to ensure that our young people and our children are appropriately fed. When you look at contributions that the Canadian government's making to varying programs and aids and so on across the globe, I think it's important for us to also remember that while the aid and support is important to those global challenges and so on, it's also important for us to take stock and recognize what are needed in our own community and in our own backyards. And I think really this is the subject that we need to develop a tremendous amount of additional advocacy. I'm going to work on a few motions that I'll bring to council because I think it's important that also FCM, which is the other municipalities, get involved. In fact, we just had the FCM AGM in Toronto this weekend, and many municipalities from across the country were here. And again, we all have the same needs and requirement to help and support our children. They are our future. And in fact, if we don't nourish and if we don't nurture our future generations, they will not be the strong, smart, intelligent, and socially contributing members of our society, as well as contributing to the world being a great and better place. So, as I said, I'm supportive of the motions that are moving forward, and we have to do more. And again, thank you, Dr. Davila and team, for the report and the presentation. Thank you, Mr. Chair.
Thank you, Councillor Thompson. Before we proceed to the, and there's no other questions. So sorry, comments, my apologies. Go ahead. Before you do, though, I'm going to ask Councillor Perks, may I have a motion to extend until the agenda is complete?
I move that we extend to complete the meeting.
Thank you. All those in favor? All those opposed? That's carried. Thank you. Trustee Srishkanaraja, you may go ahead.
Thank you. I just wanted to thank Director Roy for his work in the community and, of course, on this motion, and, of course, fully support it. And I just wanted to take the opportunity, because I just want to make sure we discuss this as well, that I think we're talking more about food insecurity because it's affecting more people. But the reality is there have been communities that have historically been facing food insecurity before it became so pervasive that there's been more interest in it. And I want to make sure that we continue, and I don't know where this fits into this, but I just wanted to make sure it's in the conversation, that we continue our commitment to the Toronto Black Food Sovereignty Plan, and all that work that has been done about how food insecurity has looked, and that poverty doesn't look the same across the city. And so though I appreciate that's getting more attention, these are conversations that I've had for a very long time. And I think we need to make sure we also don't lose sight of the fact that everyone doesn't experience poverty in the same way. So thank you again.
Thank you for those comments. Go ahead, Director Zhao, sorry.
Yes, thank you. So I think I support the motions. Just one caveat is that, in the striving for the goal of universality, we must not forget about equity, because I was actually a recipient of one of these student nutrition programs, but because I was absentee from school 1/3 of the year, I actually didn't get to take advantage of some of these services that were provided. So I think when we are, providing this universally to all schools, we also have to think about how can we reach those schools where there's high truancy rates and students who aren't going to schools, or parents who aren't able to sign these permission forms for these programs as well. Thank you.
Thank you for those comments. Okay, so we'll now proceed to the voting. So we will put up Director Roy's motion first. A. Motion A. Okay, all those in favor? All those opposed? That's carried. We'll proceed to motion B, and there is a slight amendment to motion B, where it says Toronto Youth Council. We've changed it to Toronto Youth Cabinet. Okay, and the change should be made when it's posted. All those in favor? All those opposed? That's carried. And lastly, Councillor Bravo's motion. We'll put that up as well. Okay, all those in favor? All those opposed? That too is carried. And as amended, all those in favor? All those opposed? That's carried. That's good. It's wonderful. We're doing Great work here today. So the next item is item HL 4.3, making electronic participation for the Board of Health permanent, an update on review of the Board of Health procedure bylaw. We do have a speaker to the item, and the person's online, and it's Daniel Freihert. You may go ahead, Daniel. You have 5 minutes.
Not the most exciting item on the agenda, apparently. Thank you very much. Yeah, as you know, my name is Daniel Freihert. I do a lot of advocacy. How's my microphone, by the way? Is it okay?
Yes, we can hear you. Go ahead.
I do a lot of advocacy on Twitter under my handles Lion Advocacy. I started primarily speaking about the problems of vaccine mandates, but I've touched on other important social issues. I've been in touch with this board a great deal, relatively, on the vaccine mandate policy, which extended until November of 2022, and I'm pleased the board listened to the public and advocates such as myself to rescind or cancel those policies. I wanted to speak today about the issue of virtual board meetings. It's something I've benefited from and I've leveraged, as I did today. I've done delegations and I've done speaking in person and electronically or digitally. And so I feel like my experience may be of some value to this board. I did have the opportunity to briefly review the Chief Medical Officer's recommendations and the new bylaws, and I wanted to provide some comments. My main message is that what I want to deliver today is that having the option for whether it's speakers or board members to attend virtually, I think the board needs to understand that in person is an extremely valuable tool and it needs to stay in place. Okay, it's not just for professional development, for leadership for the next generation, for equity. In person needs to be the default. It needs to be prioritized. And of course, while the board should accommodate requests for virtual meetings, I think it's integral that it keep in-person option going. So, and I say that because the way the bylaw was drafted, it sounded like this board could start meeting electronically and that nobody would know, that there wouldn't be any difference under the bylaw. So my suggestion is that the bylaw be clarified that in-person needs to stay in place. The confusion, I think, and my first observation, by the way, with respect to the presentation by the Chief Medical Officer, is that ultimately the decision to move these to have an option available for virtual presentation, it's not really a medical recommendation. And so I just want to clarify that as an observation and as a point. The decision to move these or to give a virtual option was stated in the report, in the Chief Medical Officer's report. It's to improve access and mitigate issues around childcare, time off work, other factors that limited attendance, but it's not a medical recommendation. That's important because a lot of people, some people may not choose to attend in person because of their concerns about medical issues, but a lot of people just do it like the medical officer, Chief Medical Officer advised because of, just practical ease of attendance issues. So that's an important point to keep in mind. As this board references the medical officer's report, it's not a medical report. It's just it's more of an equity report. Observation 2, as I said, it doesn't make the new bylaw doesn't make clear that meetings, the default should be in person and that people should attend in person unless there's some other logistical reason for not attending in person. As I've said, in person is key for developing the next generation of leaders. Okay, and so this board should not move to electronic participation only. In terms of practical tips, okay, what I've noticed some councils do, City of Hamilton did this to me, they put me on mute when they don't like what I'm saying. And it's not even the chair, by the way, who puts me on mute. Sometimes it's some other staff person that puts the speaker on mute, or they eject them from the meeting just with the clicks of buttons. That should not be a point of practice. It should be, people should be treated humanely, regardless of whether they're electronically attending or attending in person. And you wouldn't mute somebody by clicking buttons in real life, nor should you do that virtually. And I'm almost tempted to test you guys to see if you're going to do that to me today, but I won't. So the decision to mute someone should be left with the chair, not with the clerk, because in the case of Hamilton, it wasn't even the chair that muted me. It was somebody else that the chair didn't even ask me to stop speaking. So it's a very weird situation. And again, the importance of making sure that virtual attendance is optional. Do not make it the standard. There's also public health reasons why you want people to attend in person. As weird as that may sound, coming out of the pandemic, for public health, mental health, well-being of people, people need to be around people in person, not electronically. And so again, accommodate all you can, but for public health reasons, make sure that these meetings stay in person. Thank you for allowing me the opportunity to delegate today.
Okay, thank you. I don't have the ability to put you on mute, unfortunately.
Myself, Mr. Chair, thank you.
Any questions for the deputant? Nope. Okay, thank you for coming in today. So just to, this item itself, we adopted this at council and at committee of council as well. And really what is, just to summarize, it's really just to continue what we've been doing, make it permanent, with the exception of C, in that changing quorum, to achieve quorum, we have to wait 15 minutes, it's now 30 minutes. And the reason being, sometimes we have difficulty connecting and have issues electronically. So it's just to give staff time to actually troubleshoot. So that's really the gist of this change. Any questions about this? Okay. Anyone who wants to speak to it? Seeing none. All those in favor? All those opposed? That's carried. And that's the end of our agenda. Thank you very much, everyone, and we'll see you next month. What? Early July, apparently, according to Dr. Dimila.